the Aging and Vision Loss National Coalition.
So welcome to the kickoff meeting of our Aging and Vision Loss National Coalition. I'm Lee Nasehi. Yes, the name on my driver's license is Leone, but most of you know me by Lee, and I have the privilege of serving as the president and CEO of Vision Serve Alliance. And Vision Serve Alliance has the privilege of administering this wonderful group that is known as the Aging and Vision Loss National Coalition. We have a rough agenda. We will be spending the bulk of our time in breakout sessions, where we can dive a little deeper into the plans for each of the committees of the coalition. And to maximize the effectiveness of our time together, we asked you, as part of your registration, to view the video that we assembled, we being the steering committee of the coalition, that would give you a little background about how we came about, how we are organized, and what our priorities are at the moment. So we noticed that many of you did open up that video and start to watch it. It is a long video, admittedly. It's 90 minutes, and most of you got more than halfway through it. If you didn't finish it or even open it, it's not too late. You can always go back and do that. And please know that we're happy for you to share that with as many people you think that would like to view it. We also shared with you the documents that we have created as a coalition so far. Again, as background, so you can sort of hit the ground running with us today. The first 2 years, it's not quite 2 years, but let's say a little over a year and a half of the coalition's existence was spent, sort of finding our way, finding our rhythm, finding our structure, and creating these basic documents. Last summer, we realized as a steering committee that it was time for us to get focused and accomplish a few things. Before I go into that, I just want to make sure, in case you didn't watch the video or read any of the documents, that you have some idea how we are structured and how we came to be. So I think looking at the list of you, I can see many of you have been professionals in our field and engaged in aging for some time. And so you would be familiar with the agenda for the 21st century for aging and vision loss that AFB, the American Foundation for the Blind, led for many, many years. And that is the foundation of this coalition. When AFB made the decision to shift their focus a little bit, Vision Serve Alliance was asked to step in and sort of pick up this most important issue, as there was still much work left to be done. Those of you who know me know that I came from a community-based vision rehabilitation organization, Lighthouse Central Florida. And in that capacity, working with Lighthouse Central Florida, we served people who were older than 55, who are living with vision loss. And so I was familiar with aging and vision loss, but I really did not have the appreciation and passion for it that I do now. Working with all the other members of the steering committee, I learned a tremendous amount in the last 16, 18, 20 months about aging and vision loss. First of all, the sheer numbers. So we're using the number of 12 million Americans over the age of 60 who are having significant difficulty seeing after best correction. They may not be legally blind, but it is enough to affect daily functioning. And that's right now, it's at least 12 million, and it will at least double by the year 2050. That's a lot of people. And if you've been in this field for any length of time, you also know that it is the least well-funded of all the population groups in blindness and low vision. What's wrong with this picture? And finally, what was striking for me is that there really isn't any organization that I'm aware of yet, and if there is, please raise your hand, that focuses exclusively on this issue. And we want to change that. We want to assure that the probably at least 95% of older adults who could benefit from professional vision rehabilitation services and are not, that they will receive services in the next few years. It's going to take all of us to do that. It's going to take us innovating and thinking outside of the box. The notion that just doing more of what we've been doing for the last 20 years is going to catch us up with the deficit in meeting this need is not well thought through. That train left the station a long time ago. Nor is there one single magic bullet or silver bullet. It's going to take all of us who care about this to innovate, to think, and to work together and beyond our field. Our critical tenets of the work of the coalition includes bridging gaps with the aging network, allied health, certainly eye care professionals, and even within our own field of vision rehabilitation, making sure more of us understand aging. Because you may understand vision rehabilitation, but you may not fully appreciate the nuances and particular unique needs of aging and vision loss. And then finally, the pandemic has exacerbated all of the issues that make this a particular burden. So, are there challenges? You betcha. But I think that we are on the path to doing something amazing together. And this kickoff meeting is the beginning of that. We have a steering committee, and that steering committee includes Lauren Branch.
Zoom, but that's okay. But you
sorry. Okay. So I want to introduce the members of the steering committee and just call out a little bit what the work, the focus is of each of those committees, because you did sign up for a breakout session with one of these committees. And I'll come back to what that means and what it doesn't mean. So first of all, the steering committee is co-chaired by myself and Lauren Branch. And Lauren Branch is on the screen. She is also the chair of the board of Vision Serve Alliance and the CEO and president of New View, Oklahoma. Lauren's organization has been an innovator in vision rehabilitation in many ways and has an exciting new pilot project in aging. So we're thrilled to have Lauren. Say hi, Lauren. She's muted.
Hi, everyone.
Then we have 4 committees of the steering council, and they're co-chaired, each of them, and those co-chairs all serve on the steering council too. So I will start with Sylvia Perez. Sylvia, I hope all of you know from MSU's OIB TAC and longtime member of the field. She co-chairs the Public Awareness Committee with Nancy Miller. Nancy is unable to make this meeting today, but Nancy is the executive director and CEO of Visions in Manhattan, and a longtime participant in the aging field, and has some pretty amazing programming going on at her organization too. The second committee I'd like to introduce is Policy and Funding, and those are co-chaired by Mark Reichert with AER-BVI, and now also serving as our policy director here at Vision Serve Alliance. And Pris Rogers, still with AFB, but so involved in so many things. And if you don't know Pris, you need to get to know her. I consider her the muse of everything we do in this field. She's the wind beneath our wings, I'll tell you. And then the next committee I'd like to introduce is Data and Research, and that committee is co-chaired by Jackie Borchardt with Vision Forward. and John Cruz, who retired not too long ago from CDC after a lifetime in data and research, but also in program administration of vision rehabilitation. We couldn't have a greater champions in this committee than Jackie and John. We really appreciate them. And then last but not least, we have a committee dedicated to access to quality rehabilitation services, and that's a biggie. And that is co-chaired by Ellie Dupre, who is the executive director of the Florida Agency Serving the Blind, and also working with AER BVI and accreditation. And co-chairing that is the chairperson of the board of AER BVI and also with AFB, Neva Fairchild. So we'll just ask each of you to unmute and say hello to the group.
Hello, everyone. This is Neva Fairchild.
Hello, everybody. This is Ellie Dupre.
Hi, this is Jackie Borchard.
Hi, this is Chris.
Mark here.
Hi, I'm Sylvia.
Sean Cruz.
Okay, I think that's everybody. Also helping us with the meetings today are my colleagues, Wendy Himes and Ben Lay. They're both on the Vision Serve Alliance staff. And the wizard behind the curtain of all of it is Megan. Is it Doty? I'm just thinking, I don't know how to pronounce her last name properly.
You are correct, Dodie.
Okay,
Yes.
Doty. And she is the lovely wizard behind the curtain managing the overall meeting. So this is an exciting time for us. Let me just hit on a few things about the plan and the committees and what we're looking for from your participation today and what we're not. So frankly, the very first thing that we undertook this summer as a steering council was to articulate our theory of change for aging and vision loss. And so that was one of the documents that we shared with you, and we have it in several versions. We have the long version, and then we also have the shorter text version, and we also have an accessible graphic version, just a one-pager that attempts to boil it down. So what is the theory of change? Essentially, it is our beliefs. What are the basic things that we need to do to make a difference on our problem? And our problem is that not enough older Americans have access to the services and the resources they need to be able to age with dignity and grace in place. And so we want to put a dent in that. And the more we talked about it, the more we realized this is, no surprise to, I'm sure, any of you, a very complex issue. And so, as I mentioned before, it is not a one-dimensional issue. As an example, it will not solve our problem, assuring the majority of Americans living with vision loss over the age of 60 are able to live in place by just increasing funding for vision rehabilitation services. It's much more involved in that. We don't have enough. If somebody all of a sudden gave us $50 billion, we don't have the personnel to utilize that. We don't have the programs in place. There are huge swaths of this country where there is no vision rehabilitation provider organization at all. So we have to think outside the box a little bit. And through our many, many, many conversations as a steering council with lots of committee meetings and task forces through that first year with many of you, we settled on these 4 buckets. So the first one, as I mentioned, is public awareness. And that public awareness bucket is not limited to getting the general public to understand vision and aging and vision loss. That's part of it. But even more important than that is, how do we connect the aging networks with ours, the allied health networks, eye care professionals, and furthering the understanding of aging within our own field. So these are all the issues that Sylvia and Nancy's committee are wrestling with. And I'll say we have a great head start with them because working with OIB TAC, Sylvia was able to get some of their funds from RSA that were not spent last year, redirected and focused on jumpstarting a public awareness campaign. So it's going to be a complicated program or a campaign, complex, but we're thrilled that Sylvia has that. So if you're interested in creating relationships, furthering those, getting the word out locally through the state, all those kinds of things, real boots on the ground with that, we hope you'll join that committee. The next one is data and research. Who thinks we have enough data and research in our field? Yes, I would say if I had to pick one area that needed the most work, this is it in our field. So many of the things that we have clamored for and worked towards, not just talked about, wanting to change in our field, like medical reimbursement of our services, requires that we have evidence-based program, and evidence-based program requires research and data collection. We have talked for a long time amongst Vision Serve Alliance members that there's no data. And while there is not enough data, I am here to tell you there is actually data that we could be using and that most of us don't know about. So I'm thrilled that we have Jackie Borchardt and John Cruz leading up this committee that will be doing real work on how we as a field, and it will mean all of us holding hands and agreeing on a few important things this year, but how we can start collecting even more meaningful data, but also what data is already out there, how to access it, how to utilize it. And then they will be getting us engaged with meaningful research projects. So this is a very exciting committee. If you have interest in any of these topics, please go to that breakout session. The third one is access to quality vision rehabilitation services. And this is a huge committee area as well. It's the fact that we don't, the issues that surround this, we don't have enough services, we don't have enough personnel who are ready to go. And what are our standards for our programs? What is a quality service? And then even connecting patients, clients, consumers with existing services is a challenge. How can that be when we don't have nearly enough services, but people still can't find and get connected? So these are all the kinds of issues that Ellie and Neva's committee is going to address with your help and probably multiple task forces over the next few years. Last but not least is policy and funding. And this is super important. It is what are the rules, the regulations, the laws, the acts. So that would be policy with a capital P that we need to influence and tweak over the next few years. I will give you an example that the Older Americans Act barely mentions vision at all. How can this be when it is such a prominent feature of aging? But it doesn't, so we need to impact that. Policy with a little p, how do we better educate and influence decision makers at all levels, locally, statewide, nationally, and policymakers in federal agencies and other nonprofit agencies in the Aging Network, Allied Health, et cetera. So there's going to be a lot of discussion about that and action, and then funding is also there too. So initially, it was pretty early in the game. We want to make some decisions about how we're going to move forward on a strategy to increasing the public funding that is available for services, vision rehabilitation services and related services for older adults with vision loss. So that's Chris and Mark's committee. And they have a pretty clear idea of what they want to start with and could use some more boots on the ground. So when you go to your breakout session, we ask you to sign up because there's no way we could manually sort people into their breakout sessions if you hadn't done that in advance. It does not mean that if you go to this breakout session that you have to join that committee. Maybe you just want to learn more about it. We will be asking you through this process later to make a commitment. If you want to join these committees and actually work, there will be an opportunity to do that. So don't feel like you're locked in or you're committing to anything. And we are going to spend about 45 minutes in those groups. And each of the co-chairs is going to talk about their priorities for the year and then solicit input from you, discuss what they have in mind, and work towards what they're going to hope to accomplish in the next 90 days. And actually, we're already into those 90 days. So by March 31st, because our process is that we will chunk down our one-year goals into 90-day rocks, we call them. And once a quarter, we will come back as a full coalition, report the progress we've made, and decide what we're going to do the next quarter. So that's our process. And then, of course, we'll have an annual meeting once a year like this. Whew. Okay, I am going to give you 2 minutes to post something in chat or raise your hand and let me know if you have any really logistical questions that you need to ask right now before we go into breakout sessions. Anybody see anything on chat, my co-hosts?
See anything
Lee,
yet?
you might also want to mention that you are going to be getting a listserv for the group.
Yes, absolutely. That is one of our first quarter rocks, is to stand up an actual listserv so you can participate and stay in the loop with the coalition that way. Thank you. I do see some chat things there. Why is my mouse not working?
Yeah, you've got one person who wants to change breakout room. She signed up for the wrong one by mistake.
Okay, so if you want to do that, Ben, what's the process for that?
I've actually already got her switched. So Melanie,
great.
you're going to data and research.
Okay, good. You have been switched, Melanie.
And then there's a question about where's the link to the breakout sessions, but that was
So
part of your
Amanda,
registration.
it's not actually a link. In just a second when we're all ready, I'll go ahead and click the go button, so to speak, and then a pop-up will appear and you can join your breakout room. We haven't clicked it yet, so there shouldn't be anything on your screen. Don't worry if you don't see it, but it'll be,
Yeah,
it'll be
it's
coming
magical.
shortly.
You're just going to get swooshed into your breakout room. And then when it's time to come back, you'll get swooshed back into the big group.
You will have to accept joining the breakout room. A little icon will pop up that says you've been invited to policy and data or something like that. Not policy and data, that's not a room, but and then you'll just click join and it will take you into there.
Lee, there's a question from someone. Can Canadians be a part of the initiative?
You betcha.
Yep.
Absolutely. I mean, you know, some
As
of
long
the,
as there's old people in Canada.
yeah,
And our AR certainly covers that as well.
And so long as they bring Canadian beer to the table, that would also be another criteria.
there you
This is
go.
being recorded, Mark.
And I just wanted to say, for anyone who's a screen reader user, you just have to tab to the OK button for the breakout room.
Thank you, Sylvia. Also like to call your attention, if you didn't access the documents that we're referencing through registration, Ben has also posted a link to the Google Drive where we have all those documents stored too. It's in chat.
And I sent you an email just a moment ago with them as well.
Great. I will also point out that one of our members had read through all the documents, did her due diligence, and said, my God, there's about 30 acronyms in here that I don't know what they are. And so I want to apologize to everyone because we had a lot of work to do, and I think we took some liberties there and never went back and did that. Ben went back and spelled out all the acronyms. We have a cheat sheet And he's also updated the documents. And you emailed them to everyone, Ben, or how did that work? Or is that what that is?
Correct. Yes, that's what I just emailed you, and I have updated the ones in the Google Drive, our Aging and Vision Loss archive, so they should be up to date.
Yeah, so these are more helpful. But co-chairs, as you go through your goals for the year, if you've got any acronyms in there, please spell them out for your group when you go to breakout. Okay, well, anybody else see any critical chat questions, or are we ready to go?
And a reminder, if you're on a phone calling in, not on a computer, just wait until everyone's assigned, and then Megan will get you assigned to the group you'd like. So just stick around for just a second.
Okay.
The Policy and Funding Committee, led by Pris Rogers, Advocate, and Mark Reichert, AER BVI.
Anyway, okay, so we have for this group laid out 3 objectives or goals, whatever we're calling them. And so the very first one, and I will go over it, Mark, and then you will elucidate, okay? That is your job. What we wanted to do with the first goal is to complete an aging and vision loss, quote unquote, message bill that includes components that provide comprehensive services and supports to promote independence and quality of life for older people with vision loss, including determining and ask for the Older Blind funding and needed language changes in the Rehab Act and Older Americans Act and others that we may identify. Plus, we will need to obtain buy-in from blindness advocacy groups and find sponsors and our support for the recommended changes. So when we're talking about a message bill, we're looking at what are all the components, what are all the things that we think we need to look at in terms of vision services for vision rehab. And that's why we have to look more inclusively than to just look at the OIB program. So Mark, do you want to talk a little bit more about that?
Sure, I can try. So for those of you who are also interested in special ed, or if you just have read your email, etc., involved in this field in some fashion, you're probably familiar with something called the Alice Cogswell and Ann Sullivan Macy Act. What we're proposing here is not precisely an analog to that approach, but it comes pretty close. So, what is that special ed bill and what are we trying to do here? I don't think anybody expects that big special ed bill or the thing that Chris was just describing to you to in and of itself wind its way to President Biden's desk for signature. It would be lovely if that happens. And yes, just like in the special ed context here, we would also be pushing for co-sponsors of that thing and push for potentially for hearings on Capitol Hill, which are not at all out of the question. I think would be a fabulous milestone sort of objective for us to think about once we really get kicking with that. But really the purpose of both the Cogswell Macy thing and this hopefully soon to be drafted message bill of ours is to be several things. It's to be a rallying point for this coalition and the blindness field as a practical matter, to be able to have a name and a bill number to talk about on both sides of Capitol Hill. But it also then becomes a repository. That bill is the one-stop shop for not just, gee whiz, we're the blind community and we're upset that older folks aren't getting what they need, and here's some general ideas that we hope you all would help us with. We actually come to the table with a bill like this with operative, actionable, ready to go, pull that trigger language. And that's an important asset for any public policy campaign to have, because you're out of the realm then of just wish listing what you want, but you're ready to go with specific items, and people can see literally and figuratively in black and white, what they mean by additional monies or restructuring the Older Blind program or pick your favorite issue. We don't have to guess, it's right here. And that helps also then with the piece of this objective that Chris mentioned toward the end there, which is about soliciting the full partnership and full-throated support of our colleague, whatever, brother and sister organizations in the blindness field and beyond, because it's important not just to have them sign on to an idea, but to a specific proposal. And that's where that sort of negotiation back and forth, gee, I don't think you have it quite right, let's shape it this way. So that's really the purpose of the message bill. And I think one of the things that Chris and I were talking about just the other day is that in so many ways, legislative drafting is not easy, but it's a little technical, but it is the easiest part of putting together a public policy campaign and a comprehensive message bill like this. The hard part, of course, is deciding what in the world it is you want to put in there. What do we agree upon? This coalition has done a heck of a lot of work, and I can brag on us because a lot of it happened even before I kind of joined on here most recently in these last, several months, in starting to build or reaching for consensus. I don't think we have too far to go, but there are some certainly the proverbial devil's in the detail. And so that is going to be on our very short list here in this first quarter, our quote unquote first quarter rock. If you approve, will be that effort of coming to tangible consensus so that then we can have those of us who nerd out with the drafting go at it. That's that. Chris, back to you.
So when you're talking about the rock, Mark, are you talking about the actual having some kind of language completed by the end of March as our first rock, at least a draft kind of language that then we can look at and decide if that we like it? Is that your concept?
Now I'm going to back up a bit and say, for as close-ish as I think we are on to consensus on what we want to ask for, I do think it's going to take a couple of meetings of this group to hammer that out. So I think it's probably realistic to say we know what that consensus will be, and at least the way yours truly does it, I typically you'd have, rather than a bill all fleshed out with ready to go legislative language, you'd have more of an outline with sort of summary provisions or rationale. So you'd be able to see, okay, here's the general structure of what this thing is going to look like. Did we cover it all? I think that's realistic to do by the end of March.
Does anybody have any questions or comments at this time? This is a really critical piece of what we're working on, and we need your input. I want to reiterate, as Lee said in the meeting, that if you don't want to be a part of this committee, that's fine, but we'll need to know before the end of the meeting, or by email anyway, who wants to actually join the committee, because Mark and I will start having meetings in the next couple of weeks, and we will plan on meeting at least monthly, if not more often, and maybe even break down a little bit. So be thinking about this as we go along, if this is something that you would like to be a part of. You're welcome to join another committee, but just think about this one if it's something you would like to be a part of. Okay, well, if there's no comments.
I did have a hand up here from Anicio.
Oh, great. Okay, all right. Anicio's on. I can't.
Anicio Correa.
Ah, yes.
Hey, Mark and Chris and everybody. It's nice to be.
Good to hear your voice, man.
Glad to be on the committee. Same here, Mark. But as much as I applaud the effort to go for more funding from the Older Blind program, does this mean that we have given up on medical reimbursement and the device equipment, the durable equipment funding, stuff like that? Can that be related to this or added?
I love this question. I love it. So there are two things that I want to make sure people who leave this committee do not ever say about what it is that we are trying to do. Number one, I don't want people to say that our highest, top, even only priority is to improve the funding for, or even the structure of, the Title VII Chapter 2 Older Blind program. I don't want people to say that. And as a consequence, I don't want people to leave and say, gee, it sounds like people are backing away from support for the Older Blind program. Sounds like they're wanting to kind of walk away from it. Neither is true, and it would not be nice if anyone came to that conclusion. You're not saying that, Anicio, which is awesome, and I'm glad that you allowed this opportunity to do this little sermon. The Older Blind program is indispensable, and even if it were fully funded, at least in my humble opinion, it will always be inadequate, because just even if we restructure it precisely the way that we want it to be, There are plenty of other avenues on which that we have to open up. A lot, if not the vast majority of the people we care about don't enter, quote unquote, the proverbial system through a structure like the state agency structure that's in place to support the older blind program, and on and on. So when we talk about this message bill, you can be confident that the older blind program will have a place of prominence that it is, well deserving of, but it most assuredly will be one of several, roughly speaking, equally as important critical pieces. We've talked about, for example, amending provisions of the Older Americans Act. Chris Rogers is teaching me about the Chronic Care Act, among other areas in which a lot of us have frankly paid neglectful attention to. So there are a number of places and some things that just frankly don't even exist yet that we need to put together. So I hope that provides reassurance there.
Great, thank you.
We really want to look at this holistically and what are the needs. But when we were structuring this, one of the things all these years, the OIB program has been the elephant in the room too. And then we felt like we really did have to address it because we just haven't in a long time. But we need to address all of this. We need to look at it all and see what's realistic right now. But like I said, to look at everything.
Yep.
So
Great,
any other comments? Good question. Good comment, Anisha.
Well, thanks for
Anybody else?
giving that up.
Anyone else? Anybody else have been in any other chat things?
This is Lauren. I just wanted to say,
Lauren?
is that okay if I say something?
Yes, please.
Oh yeah, I just couldn't hear you.
So Anisha asked regarding, reimbursement. And so, I mean, just to expound a little bit on what Chris said, that is absolutely not off the table. And so but there are certain things that have to happen in order for that to come to fruition. I mean, when we've tried it before, we've had, come across certain obstacles. One of those obstacles is the evidence-based,
right,
outcome issue. So there's a subcommittee. So in looking at all of this aging and vision loss, I mean, we're looking at it across the spectrum. So, every point where there should and could be impact, we're looking at, and then looking too at what things need to happen in order to move those kinds of things forward. And I mean, Chris, you may want to add, but that was one of the big obstacles. But when we talk about engaging the allied health people, engaging, the eye care professionals, our optometrists and ophthalmologists, all of that works together to play into multiple streams of reimbursement to put into the system to address a really overwhelming problem.
Thank you, Lauren. And I think that that's an important point. And when we looked at the theory of change, and we had to look at how everything interacted with each other, and it, one just depended on another. So bear with us as we try to work all these convoluted parts together. It's something we've been thinking about for a long time, and I'm glad at least we are looking at, like I said, the whole thing, not just pieces of it.
I suppose maybe I should jump in with the footnote that says, so reimbursement for services, reimbursement for devices, two obviously inextricably linked ideas, but yet somewhat separate. I think the device issue would probably be hit head on a bit more, in neon lights, as opposed to the reimbursement for services issue, which I want to cheer on Lauren's comments. Back in the day, we had proposed, and it moved fairly well through the legislative process. We had language that went through at least the U.S. Senate that would have established blindness-specific professional disciplines as among the professional folk for whom services that they provide would be reimbursable. I doubt that will appear as that effort appeared in this message bill because of exactly what Lauren said, which doesn't mean we're abandoning the issue. It means other things that we need to build into this bill need to lay a firmer foundation for that work.
Any other comments, questions? All right, so it sounds like we have our first ROC, which is basically by the end of March to have an outline of the major pieces that we want to include in this message bill. Pretty simplistic, but hey, right now I guess that's as far as we can go with it.
There's a lot packed in there.
I'm sorry, what did you say, Mark?
I said there's a lot packed in there, and it
Yeah,
sounds like someone else is looking for the floor.
Oh, okay.
I think.
Someone else.
I hope.
All right. Well, then let's move on to the second one, goal. And that is build relationships with key stakeholder partners about specific asks, such as connections with organizations like Prevent Blindness. They're the ones who have the Congressional Vision Caucus and the National Council on Aging. Those are just some examples, but we thought that as we were going along with this message bill, that we would be needing to elicit support from various organizations, and that would be a part of what we would need to do in making this message bill or parts of it go forward. Mark, do you want to elucidate on that?
Only to say that if in listening to what Chris just said, you think to yourself, gee whiz, I thought I heard part of that in the first goal. You'd be right. What we're trying to do in the first goal by reference to getting the buy-in for blindness groups. Everybody is lovely, and all the groups are equal, but some groups are more equal than others, I guess. I'm saying that with a smile, but I think you get the point that there are, some of us that are sort of close in, always work with each other, have a bit more of an ongoing communications and other, even indeed public policy partnership set up. So we want to start with those indispensable partners first. This goal that Chris just read is really about the broader community. And yes, there's been plenty of work that Chris and plenty of others have already laid the foundation for. But once we have our set of asks in place and have those key, can't live without them, almost veto like partners in place, then it's time to reach out and find additional allies who can help us perhaps refine that message a little bit, but mostly their job, as we would hopefully enlist them to do for us, is to stand with us, make common cause where possible. That's what this goal is all about.
So I don't know if we need a rock for that between now and the end of March, except to possibly start coming up with a list of potential groups that we would want to start forming partnerships with. And that might be something that our group would want to do as we work along on this. Anybody have any thoughts? Go ahead.
I think that's a great idea, Chris, in that I think, especially for a couple of us who, I'm certainly no stranger to these issues, generally speaking, but Lord knows in this latest round, I've not been privy to sort of the work that you and others have done as yet about who's talked to whom, and maybe even if it's just for internal consumption, getting a list of who all those potential partners could be. They're all important, but ranking them in terms of who we ought to reach first, who we have the better connections with, and frankly, who among us has the best existing relationship with them to capitalize on it more.
Any comments from people out there on the call?
And Chris, I agree with you. I'm not entirely sure this is rock worthy, as they say.
Except that we don't want to forget that we do need to work on it. So,
and I'm agreeing with your point that certainly not by March 31st.
Okay, then the third goal that we want to work on is developing supporting materials and tools for use with our coalition as well as related stakeholders. And those would be things like one-pagers that would comprise a toolkit of information that advocates could use, for example. And we have done that in the past. I remember years ago when AFB was working on trying to get the funding for OIB, we put together, a fact sheet that we used throughout the country, and it had all the, critical information in it, and it was used by a lot of advocates. So that's something we can do, and we already have the start of some information because our former funding committee put together a policy brief that has quite a bit of information in it that we can pull from for starters. But that would be something that we would get going. Also, another part of this, and one that I frankly am rather excited about, is to start the development of an advocacy training program for older people to get involved in, older people with vision loss, as a way of them being able to get empowered and involved. People who've gone through our OIB programs or vision rehab programs in the various entities and want to have a chance to give back and help us with this whole advocacy effort. Mark?
Hold up, mute is currently unmuted. Hold plus A button.
Anisha, are you?
Amen. That's all I have to say about that.
I was going to say, you know, as this whole initiative, and certainly this committee, but the whole initiative of the coalition, it in some ways this pandemic, horrible pandemic, right? But that has forced us to really take advantage of this technology. May in fact be may enable us further to go farther than we would otherwise, you know, by leveraging the Zoom and video conferencing, and especially when you're talking, Chris, about reaching out to the elderly and provide advocacy workshops, taking into account transportation barriers, etc.
You're right, Anisio, and I think people have started to use these tools that never had before, whether even if it's for something like going to church or you know, just normal activities that people want to get involved in. They've learned through family members or whatever to do it, and so it does give us a good venue. Mark, you were starting to say something.
I was only amening what you said, so keep on trucking. It's all good.
Great. All right, so we will need rocks for this particular goal, and we actually have two kind of separate parts to this goal. So at this point, through the end of March, I don't know that we would be ready to have the one-pagers, although we might start working on what we want to pull out, but without knowing what the message build itself is going to entirely contain, I don't know how far we can get with that. But certainly the second part on the advocacy training, if we could start to think about who might be able to be involved with that, how we might provide that type of training, what kind of training it ought to be, just kind of think through all those logistical things and come up with at least an outline that we want to help us get started on that. That would be my recommendation. But do others have thoughts on that?
I think this group needs some espresso.
I do too. I don't know how to get you going.
We have to say something objectionable first, I think, is what I'm saying.
Darn, I should have thought of that. Okay. Hey, hey, Mary Marcel.
I was just going to say, I think that this is all very, very exciting. And I work a lot with villages, the villages in the Washington, D.C. area, of which there are 26 just in the D.C. metropolitan area. It's come to my attention that many of them have now support groups for people with vision impairment. And so I see this in developing that and maybe beginning to really focus on that advocacy and beginning to identify and build an advocacy population as something we could start and draw in. I think their own insights as to what we could do and what needs to be done. And I see that overlapping with your objective too, as a bucket of those partnerships that we want to foster. Sometimes for advocacy, sometimes for outreach, sometimes for funding, sometimes for public policy enhancement. But clearly this is an overlap with the objective number 2 as well. And I think it's a great place to get started.
That's a great idea, Mary. I wouldn't have thought about that, but you're absolutely right with those types of groups getting going. I wasn't thinking outside the box on what other groups we could involve. Great idea. Well, these are the 3 goals that we have set up. There may be other things that you all in this room, don't you like that? You all guys is what I used to say when I was in college and running a program. I came from the South, and all the people in the college Dorn were from the north, and so I got used to saying you all guys. So here I go again. Anyway, so do you have other thoughts on your minds about things that we ought to be looking at regarding policy and funding? Because these are our thoughts, but you may have other ideas that we haven't thought about, and that's the wonderful part of a coalition, is to bring in your thoughts and ideas.
Well,
So
this is Mary.
Go
I'm
ahead.
just going to speak up very quickly and say one of the audiences I haven't heard discussed in any of the 3 objectives, but I would like us to include our long-term care. I think there are separate policies that establish criteria for government review, certification of long-term care facilities, assisted living, even if we step way back in terms of just senior communities. And I really don't see this issue being addressed there. And I can tell you that, for example, when we get to even the research, when you're going into a long-term care facility, there are intake examinations that are required, and I worked a lot in oral health for older adults, and they have to do an oral health assessment when someone moves into those communities. I don't know if there is part of that. There's an assessment about the vision capability of the individual when they go into these facilities. But I mean, I think there's things we could be doing to heighten the awareness of the need to focus on vision impairment, and not only establishing where people are when they come in, but then what the facility needs to do to create an adaptive environment for them.
Well, I know that's something that we've talked about with some of the other committees in terms of doing the assessment piece and what we need to be doing. So it's not a part of ours, but it is a part of what the coalition, what we're looking at all of our goals. So thank you, Mary, for bringing that up, and the other thing about it I want to say is we're working on our first year plan. We do have 3 years that we're planning out, and those are some of the things that we're looking at as well. So thank you for bringing that to our attention. So anybody else have other ideas?
Queuing up.
I'm sorry, Jeff?
I think
Okay.
Jeff Tom is queuing up.
Oh, yeah, I did. Thank
Okay.
you. I just, and Mary's sort of nursing facility reform idea really ties into this quite well. I think that on the third goal of having advocacy tools, that even though every state is different, we need to provide a part of that toolkit that can be used by advocates at the state and local levels, because in reality, in the short term, especially, a lot more can be done in terms of funding and policy changes at those levels that can probably be achieved at the federal level.
Right, and I know one of the things that John Cruz was looking at is how to pull data for different states so they could have the information they needed, and so it could come up with a fact sheet that would just go for your own state, for example, if that's what you're trying to get at, so that people would have that information to be able to talk locally or statewide. Yeah, excellent point.
Public Awareness Committee, led by Nancy Miller of Visions and Sylvia Perez, OIB TAC.
So I am going to go over some of the goals. Unfortunately, Nancy Miller from Visions in New York couldn't be with us. So I'm going to go over just a few of the goals that we have set, and then ask you guys a few questions. So as Lee mentioned, we were really fortunate at the OIB TAC to have, we were only fortunate to have leftover money. We were fortunate to be able to use leftover money since we weren't able to do some of the activities we normally do really around travel last year. So we went back to them and they were like, well, what can you use it for? And I said, well, awareness is a really big issue. Those who are familiar with the OIB program, which is the federally funded dollars, and I know that some of you represent agencies that might not receive older individuals who are blind federal dollars or Chapter 2 dollars, but that program has about $34 million a year only. And it serves right around 50 to 55,000 people annually, which, if you remember the number Lee told you, was something like there's at least 5 million people who are potentially eligible for older blind services. So we're not even at 5%. So we know that it's a challenge. And so my proposal to RSA was let's figure out a way to do some kind of campaign to make people aware of services. And that's a you know, a scary kind of thing, because if a lot of people become aware, then our system could get flooded, which is why the other committees are so important, that we have quality services, that we're seeking out additional funding streams, et cetera. So we actually, they agreed. We had to put that out for a competitive bid through Mississippi State University. We are in the process of executing a contract with a national advertising agency. It is not finalized yet, but my anticipation is by sometime next week it will be. So that is actually in process, and what that will look like are TV commercials, radio spots, and digital media spots. And one of the things we asked them to do is to also create opportunities for us to connect with, you know, for interviews. We're not sure how that's going to work, but if you have connections out there, like you can get us on Oprah Winfrey or something. I don't know. I mean, well, she didn't have a show anymore. Who has a show? Dr. Phil, somebody. But it's really about how can we create awareness. And it's not just awareness of drawing people to services, it's awareness that if you, as an older individual, experience vision loss, you do not need to isolate yourself, go into a nursing home, etc., that you can still have a rich and meaningful life. Because having worked in the field for all these years, I all of you know how many times you've encountered people that said, if I only had have known 5 years ago, 10 years ago, that these kind of services existed. So we're trying to counter that and make sure people do know. And so our target population is not just the individual who needs the services, but it's their family members, it's the social service agencies, it's the aging arena, the senior center, anyone who, you know, maybe even our eye doctors will be like, oh, well, maybe I should be referring people for these services. And one of the things that clearly came out when we started working towards this campaign and talking to ad agencies, because we don't have a ton of money, and TV commercials cost a lot of money. And they all said to us that TV is important, because if you have a commercial, you are real. And so we plan to have that. But one of the things they'll build is a toolbox, and they'll have these commercials that then we can pass off to any of you that you could then use in your communities, in your areas. You could go to your TV station, to your radio station, and get your contact info on them to keep promoting them. So one of the things we're going to try to do is to make sure that we're using good language that attracts the aging. And so the Reframing Institute did a study on aging. So we're really going to try to make sure, like, we're not going to use the word blind. We're going to try to be really careful in figuring out what is the right message. And I think that's a place where some of you can be really key in helping us frame what that message is. Have most of you seen the aging flyer that, so it's really interesting. It goes back that Neva Fairchild, and then I want to point out that Neva and I are both blind, okay? So we had a very small committee, me, Neva, Nancy, and a couple other people, and we were like, we need a flyer. because, you know, a lot of agencies have flyers, but we need a flyer that can kind of go out, that people don't have to go and find somebody to create for them, something that's professional looking and that you could put your logo on and your contact info and utilize. So Neva and I, who are blind, came up with the basic concept for the Amsler, the eye chart, the Snellen chart.
Sylvia, would you like me to share this?
Yes,
on my-
please, with the Amsler grid over it. I was about to, so I'm thrilled that you will do it. We came up with that concept and Visions took it and made it professional. And this was put out, it's been out by like 6 months for use. So if you're not using this already, please try to do so. But one of our goals is that 50 agencies will start using this. Does anybody have any questions about this flyer? It is accessible, I think, through that Google Docs. You can email me. I'll post my email address in here when we're.
Trying to share it, Sylvia. I'm
Is it
not
not
seeming to
working?
find it. Do you have it handy to share?
I
I had it a minute ago.
Really?
Hold on
Is it
just
in
a
that
second.
Google Docs?
Yeah, I've got it. I just can't figure out how to share it on the right window.
Oh. Well, so we want 50 agencies to start using this. So if you're not using it, because we want you to track the results of, does this actually bring in additional people? And what it says is, if you can't see something, say something. It's a very simple one pager. So
I've got it up. I've got it up now.
Oh, she got it. Good.
Oh, yeah.
I know that a lot of you are familiar with it because at the OIB TAC conference, we had a whole presentation about it. So has anybody used it? Let's just ask, anybody put this into use? I know there are agencies that have. Silence.
This is Elias, Sylvia. I have not, this is the first I've seen of this, so I definitely want to put it up on our Vision Aware site. We have a specific link that we have where we're using in advertisements for like different journals that are out there for, you know, individuals, for doctors and for social workers. And I think this would be really neat to have on that page that we have, that we are guiding people to. So I definitely, you said we have access to this through a Google Drive.
Oh, yes.
The one that Ben mentioned at the front.
Okay.
And
Great,
there are two versions. There's a Word version where, as you see it at the bottom of the page, you can insert your own logo of your agency and customize it for your own use.
Nice. Okay. Yeah, that we're definitely gonna.
So you might want to put the APH directory or something. I don't know.
Yeah, we'll put the phone number there. We'll put the Vision Aware site. Yeah, definitely, for sure. Okay, yeah, this is great. Thank you.
So the goal is that this will go out and that agencies will track their results. Are you seeing increases in referrals? And can you attribute it to the use of this flyer? And we may be incorporating some aspect of this flyer into the national campaign. I am going to send this to our ad agency to see what they think for consistency's sake. So.
Hey, Sylvia, this is Stephanie. Like how it says older people who cannot see well, make life better for older people who cannot see well. And when older people start having trouble seeing for whatever reason, they can't see well. And blind is not them. Even
Right. That's why
they're legally blind, even if it's whatever, even if glaucoma's taken everything, and macular degeneration, blind is someone like you, Sylvia. It's somebody like Neva. It's somebody like my brother-in-law that was blind since almost birth. It's a completely different ball of wax, completely
It is.
different, even if they can't see, I don't know what. If the people they're seeing is blurry, it's not blind.
Right.
They can't see as well.
Right. So we're trying to make sure that we are very careful about that. And thank you, Stephanie. So the final goal is really around the toolkit and creating a toolkit that all of you can use. So, you know, as I said earlier, the flyers, the digital, the social media content, the digital media, the radio spots, the TV spots, etc. And then, you know, our goal is, this is later down the road, is that we have at least 50 agencies utilizing those, of course, with our help. So any comments on that? So one of the things, this is one area that is not, we don't have listed, but has come up. We know that there's really, it's difficult to find services. State agencies could be listed under Department of Education, Department of Health, Department of Labor. They're all over the place. Private agencies might be called Lighthouse. They might be called Center for whatever. There might be an independent living center. There's no easy way to find our services at all. And so I know that APH has a directory, but what we want to make sure, and they actually have a phone number too through their Connect Center, which we will be using in our campaign. I asked them yesterday. Well, okay, I have to say that I was like, oh, Elia, we're going to be using your phone number. Hope you're okay with that. Not so much asking, but we do feel like we probably need they have a directory, but we really are thinking what we need is one very catchy website that if someone heard on the radio, they go, oh, I need to go, that's the website I need to go to find services. We were kind of
Sylvia?
Uh-huh.
This is Debbie Bacon. Just really quickly, you were talking about phone numbers.
Mm-hmm.
I would suggest, if we can, to get a national, simple, like 511, 611, whatever phone number that can be dialed, which then can link people to their states where they can get, you know, immediate access to providers within their states. That's part of the problem. I get calls from all over the country, and I have to go dig through and find out where to send people. So that would be one suggestion I would have that should be out there in media everywhere. It makes it easy for people to remember, and they don't have to mess with a lot of buttons on the phone.
Yeah. I don't know how to make that happen, Debbie.
I'm making notes. We'll investigate. We have somebody with their hand up.
Go ahead.
Pacheco.
Yes. I think the top of your flyer is quite good because it's addressing it to the person who is experiencing vision loss. But that line at the end, which I don't have in front of me now, isn't that kind of singing to the choir? Help make it better for other people, for people experiencing vision loss. To me, it seems as though there should, maybe for you and other people, if you want to gear this toward people who need to actually get themselves into service, it's coming off more as an advocacy than a help your. Does that make any sense?
It does. It does. Yeah, it does. Okay. You wrote that down, Wendy? Yeah, that's something for us to work on.
Yes.
So we'll have to work on the flyer in the committee for sure. And so thinking about, what we're thinking here is that maybe we need to have a specific website. The phone number, we were going with APH because they have a dedicated phone number that has been around for a long time. And they have people who can answer it. And that's the key thing, is somebody who can answer it, who can connect people to their local services. But what about people who don't use the phone? And so having a website, and we don't know what that, what that could be. So if any of you have ideas, that's one of the things we're going to want to have in our committee as well, and help developing out that campaign. Now our ad agency will do the bulk of the work, but we really need good ideas of what will reach the
Sylvan,
most.
this is Janice Hack with Lighthouse Louisiana.
Mhm.
So who would a website would be like adopting a child. So who would be the one to host it, pay for it, and keep it updated? Is that
Us at Mississippi State? That's our
Oh,
plan.
okay, you
But
got
we need a good, clever, name or something for it. And then what we would do is ask agencies to, just make sure that you're in for, and in fact, we would link over to the APH directory as well as some national resources, but making sure that we had the agencies in there that were providing services to older blind individuals.
I have somebody else with their name, with the question in the chat, and she also has her hand up. Janet Weinstein, you want to go ahead? You are muted, Janet. Please unmute yourself.
Okay, hi, I'm Janet Weinstein with Lighthouse Guild. And yeah, my question has to do with the fact that I guess there are a few different factors. I mean, we're all from different parts of the country, and I'm thinking of your point about, I know that there's, in some areas like where we are, there are multiple services for people who are visually, who need vision rehabilitation. In some areas, there's nothing. Same thing with the availability of eye care. I guess my question is related to the fact that, and I have it in the chat, many people who may have trouble seeing, they're not necessarily, don't necessarily have vision impairment. In fact, most of them probably just haven't had an eye exam, especially older adults. That, or they may have cataracts that need attention. That's something we always try to emphasize. I guess I think it's a great idea to have some kind of central place where people can call in or email in or whatever. But I guess the first question I would want to ask is, when was the last time you had an eye exam, to make sure that anything that could be, corrected or minimized medically or surgically is taken care of, especially in areas where vision rehab resources are more limited.
So almost a little checklist. Have you done these things before you reach out to these services? Have you done these things? That's a great, yes.
Yeah.
Great idea, Janet.
Yeah, thank you. And I think the other point is, and we're thrilled to be able to, I mean, I know we do work with Vision Serve and everybody, but in terms of this new momentum, working with older people is a special interest of mine. And of course, the population's only growing. And these are, yeah, I mean, that's going to continue to happen. And the multiple needs of people who are older, but really, the paucity of resources and the paucity, especially of low vision resources. I think that's even scarcer than vision rehab. So,
I also want to tell you in the chat, Steve Kelly says he owns a website with the URL myvisionloss.com, and that we're welcome to use it.
Great.
That's a great URL, Steve.
Yeah.
And Larry Johnson also has his hand up. I want to give Larry, we have about 5 minutes, folks, before we're whooshed back to the main group. So Larry Johnson.
20 seconds. I just wanted to say, with more and more remote resources, that's something we're developing. And I know a lot of other agencies are too, in terms of we'd be glad to talk about that with underserved areas.
Great. Go ahead, Larry.
Yeah, two quick things. First of all, the fact is that a lot of seniors are very reluctant to admit that they are losing their vision, that they're going blind. That's a terrible word. So one of the things that's really important in the message that's sent out is that we don't scare them away. And I think the phrase, are you having trouble seeing, is probably a lot more gentle and a lot more inviting. And you can maybe get them then to respond. The other quick thought I want to have is AARP. I think that we need to be embracing some of these other organizations that supposedly serve seniors but exclude seniors with disabilities. Maybe, you know, seniors are more aware of AARP than they would be of services for the blind. So maybe you could convince AARP to provide an 800 number, and that it could then channel the calls to the appropriate state or affiliate or organization, a chapter within it. But I think it's crucial that we, in our public outreach, that we involve non-blindness organizations and agencies.
Agreed. If anyone has connections at AARP at the higher level, please connect with us, because I think many of us have attempted to make that touch and have not been super successful.
I think we need to just contact them and say, hey, you're forgetting a large segment of the population that could be members of yours, and you need to be serving them.
One more person with their hand up, Deanna Noriega.
I just wanted to say I write for the Vision Aware blog, which is on the APH hosts us, and I've been doing this for about 7 years, even when we were part of the American Foundation for the Blind. And one of the things I usually ask a senior when I first, am asked to talk to them is to say something like, well, is there something that you really enjoy doing that you're having trouble with now? And whatever it is, I give them lots of alternatives, because one size doesn't fit all when you're talking with seniors. And sometimes I can get a little bit off the wall, but if I can find that one thing that they'll accept, then we can move on, because you do it by baby steps sometimes with working with seniors.
All right, I hate to tell everybody we have like 30 seconds left, so just warning you. This
So I
been an
hope all of
amazing
you
discussion.
will sign up for the listserv and join this committee, because we really do need help figuring out what that national campaign looks like and making sure that it truly is national. And all of you will play a part in making sure we get that good, solid reach. That's my commercial at the end. Sorry, we took so long at the beginning explaining everything.
Well,
But
this
if you're
is
not
just a
using the
kickoff,
flyer,
right,
start using
Sylvia?
it. Huh?
It's just a kickoff to the
Right.
discussion.
Start using the flyer, and I will definitely take your feedback. Thanks so much, everyone.
Access to Quality Services Committee. Neva Fairchild, AFB, and Ellie Dupre, Florida ASB.
All right, I'm going to speak out the priorities that we already have identified for the Access to Quality Services Committee. This does not mean that that we're done. If you have input that you want, that is the reason that we're so excited to have you with us. We want your input, we want your thoughts, and we're only laying out the 3 that we have so far, so you'll know where we are. So priority number 1 is to reach out to the professional preparation programs at the universities to either establish or join a working group focused on access to quality services. Neva will tell you more about that.
So when we say personnel prep programs, we mean blindness and visual impairment personnel prep programs, because we want to bring the aging issues to the forefront so that the professionals they are preparing will have an awareness of the needs of people who are aging with vision loss, to help them realize that there's a need for this. Even in the programs that focus on O&M and TVI exclusively, a lot of times those O&M specialists will contract with local agencies or state organizations to provide training for people who are not children in their school district after hours, on weekends, during the summers, that kind of thing. And so we believe that aging issues are important for anyone preparing for a career in visual impairment services should have. So we figure that these personnel prep programs get together and talk about stuff. And if they don't, we want to organize that. And we want to bring aging to the table. Can Ellie and I do that all by ourselves? Heavens no. It may be that you live near one of these personnel prep programs, and when we all get back to meeting around a table instead of around a computer monitor, you might want to be the person at the table that brings aging up whenever they're talking about new courses or modifying courses or prominent issues in the field. If people in the world don't hear about this, it won't be our fault, because they really have to know, and they have to keep thinking about aging and vision loss is a big deal. And they're going to have to bring it into their preparation programs.
Thanks, Nate.
Anything, Ellie?
No, I don't think you left anything out, and in a way, it's good for us not to be too comprehensive, because we really want people to contribute. We're hoping that you will use the chat, even starting right now, if you have any thoughts. Lee has graciously agreed to monitor the chat and kind of identify themes that are appearing in the chat. So your comments, your questions, your first thoughts, you're just throwing spaghetti against the wall, all of that is more than welcome. And of course, we're going to be saving that chat, but we would definitely like you to put your thoughts out there as they appear in your mind. So the second area that we have identified as a priority is to seek opportunities to connect with federally qualified healthcare centers. We want to increase access to vision care there and connect the federally qualified healthcare centers to vision rehabilitation services. Lee was going to comment on that some more, and I think you're going to start seeing a pattern here that between reaching out to universities, reaching out to federally qualified healthcare centers, and reaching out to the aging network in general is going to engender a whole new cadre of professionals who are going to need to become highly skilled in vision impairment services. Neva, go.
Okay, so once again, the federally qualified healthcare centers are typically Medicare and Medicaid accessed by people who have Medicare and Medicaid. They vary from geographic area to geographic area as to the emphasis of their centers. For example, in Florida, many of them do deal with older people a great deal. But in New York City, we understand that most of them deal with mothers to be and prenatal care and postnatal care and pediatrics. So we have to learn a lot about this system. It's going to be an onion peeling process. But at the basic level, we want them to realize the importance of providing eye care to their older patients, because vision loss goes undiagnosed or unaddressed for many years a lot of times. And just asking a question, you know, are you visually impaired? Most older people, even though they're having trouble with vision, will say no, because they don't consider themselves visually impaired. They're just getting old and their eyes are bad. And so then they never get referred to low vision. They never get any rehabilitation training. They never find out about resources like Talking Books, even though they can't read anymore. All of those kind of things drop through the cracks. But if there's an eye exam that is a part of their annual physical and it's a dilated eye exam, then things can be addressed earlier. So we want to bring that to their attention. And then we also want to bring the rehabilitation services that are in their geographical area to their attention. So you can imagine that's a big job. There are resources they can reach out to, like Vision Aware and APH and that kind of thing, to find out what's in their area. But they need to know to do that before they can even find referral sources. So now they've diagnosed Mrs. Jones with macular degeneration and her visual acuity is 2400, and they've convinced her to stop driving, let's hope. And now what is she going to do? She's got to learn about transportation, and she's got to be safe when she tries to walk around her neighborhood or go to the store now that she can't drive. All of those things that they don't know anything about. So we need to introduce these folks and build connections between them and help them help each other, so that the people that come to these centers will get the eye care they need in the same place that they get all of their other health care, their cholesterol medicine, their, you know, annuals, and that it's not a rarity, it's a standard operating procedure for older people to get that annual eye exam. We know that people over 40 should be having an annual eye exam, but there's not a lot of them that are. So that's our hope with this new acronym. And that's probably one of those acronyms we have to spell out that Lee was just talking about, Elliot, just because I still have trouble with what the heck does it mean? I can't get all the words right every time yet.
Okay, and we'll just hit our last priority real quick because we don't want to take up so much time. We want really to hear from you. This isn't really something that we need to elaborate too much. We ultimately want to prepare a toolkit so that for local visual impairment specialists, and also to recruit local visual impairment specialists to present to local conferences about a screening tool that New View, Oklahoma is currently preparing. And because time is passing, Neva, I wonder if we should just let Lee start giving us some questions that are coming up in the chat.
Yeah, I'll just say
or calling on people who've made a comment in the chat so that they can talk.
Okay, I'll just say that these 3 priorities are for this year. We went through a long process to come up with our 3-year goals, and this is this year's, what we hope to accomplish in 2021. And that tool is being developed. It's to help Aging Network people identify participants who are having trouble with their vision. And so that's not going to be available until later on, so we can put that off. Lee, what are you seeing in the chat?
So first from Carla McCaney, Carla says, what about the reverse? Bring vision loss to the aging discussion. So Carla, would you like to put that in more of your own words?
Sure. And Ellie was talking about it as I finished typing it. But so, you know, in the Philadelphia area, you know, there is a lot of work being done on aging. And I know at the, you know, healthcare centers, we have Philadelphia Corporation for Aging, a lot of the visiting nurse associations. And I get the feeling that a lot of them are not connected into the visual impairment blindness community. So, you know, as we work with, you know, the visual impairment community about aging, I really think it's important to work with the aging community on visual impairment. And, you know, when I first started at ASB and went to talk to a potential funder who happens to be a nurse, the one thing she said to me, which has resounded through my tenure there, is just to really create these partnerships in the medical community, because she said to me, a lot of them just really don't understand, you know, where the need is, and we have to just keep communicating that out. And she especially said to me, you know, with the visiting nurse associations and these people are in the homes, that's a really captive audience that we could work with, and having this visual tool like you're talking about, you know, that's a good audience to bring it to as well.
Absolutely. Home health is definitely on our radar for that tool. And as well as reaching out to the preparation programs for OTs and other allied health, physical therapy, that type of thing. as well as the geriatric programs to, you know, start with the people when they're in their education, so that they kind of take this as a matter of course that we are going to deal with people who are aging and losing vision. And I think this screening tool and members of our profession making presentations at aging conferences will go a long way toward bringing that awareness to people who are currently in the field. But as I said, that tool is being developed at New View right now.
Okay, what else you got, Lee? Can't hear you. You're muted.
Unmute myself, yes. Thank you, Carla. And trust me, that's going to be a huge focus of, you know, a big part of what we're doing, and we will need all of your help for that as well. So the next one is from Kathy Zeider with ACVREP. And Kathy, if you wouldn't mind, rather than me reading this, just unmute yourself and share about this idea of a certificate program.
One of the things that ACVREP is doing, and our first certificate program will launch in March of this year, but ACVREP is looking at certificate programs in addition to certification. Certificate programs are developing in-depth training, and anyone then who completes successfully the quizzes and exam for the in-depth training will receive a certificate as a digital badge of accomplishment. One of the things, again, motivated by Ellie's involvement on our board, and I noticed Nalima is also on this call, and she has just recently joined our board, yay, that we have explored the concept of developing basically an aging and vision loss certificate program, resulting in an endorsement for existing professionals. Those professionals could be OTs, they could be ACVREP certified professionals, they could be professionals in any field. So this is something that we're working on because we believe it is key to providing quality services, which is our focus.
Wonderful.
That's awesome, Kathy.
It is.
Yeah, you and I will be talking about the next time you and I have our weekly phone call, okay?
Perfect.
Thank you for sharing that. All right, and we have another question, and it's from Paulette. I'm sorry, I'm going to murder your last name. Monty?
Oh, you got it right.
Oh, wow. So Paulette, tell us what's on
It's been a while since I've seen some of the folks on here. My question regarding to, based on some of the comments you just said about reaching out in healthcare facilities to the OTs and the PTs, are we, when we're looking at objective 1 for training programs, should that be also a component of the first objective to educate on aging and vision loss?
It could be if we have enough involvement. When we were setting these priorities, and Ellie or Lee, interrupt me if I'm wrong on this, we were trying to set priorities that we could accomplish in 2021. And I believe our 3-year plan involves allied health and aging preparation programs as well.
How about you,
Ellie? There are some university programs right now that do have parallel tracks with OT. I don't know if there are any for PT, but that is being discussed. And I'm really grateful to you for bringing that up, because there has always been a little reluctance, I think, to ally ourselves with occupational therapists. There are issues for employers of OTs, and there are also issues in terms of OTs' openness to working with people who are actually blind as opposed to low vision. So there are areas of that will need discussion, but there's thousands of OTs in this country, and there are not thousands of visual impairment specialists. And there are millions of people who need this service. So I think we need to be open to creating those kind of bridges. And I appreciate you bringing it up.
Yeah, what prompted me was when I was the executive director of the Center for Deafblind Persons in Milwaukee, we would do presentations regularly on deaf blindness to the occupational therapy program through the University of Milwaukee.
Awesome.
Well, the way that priority one is worded, we don't have to stick with just the personnel prep programs for blindness and visual impairment. If we have enough, boots on the ground to accomplish it.
Awesome. And Nalima has a comment.
Thank you. I was wondering, I just wanted to let you know that I was talking to Mary Warren, who brought the OTs into the field of low vision just recently. And she was mentioning that she had started the work already of adding low vision into the basic OT curriculum with AOTA. So that's something that I would be happy to work with y'all on.
Wonderful.
To get that going.
That's terrific.
That's a great connection.
Yeah, thanks.
Okay, so I've got some other comments. I'm looking if there's discussion points. Lynn, would you like to unmute and share what you had on in the chat, Lynn Dubinsky?
Yes. Hi, I just wanted to share, people may already be aware, but USC in conjunction with the American ASA, I'm sorry, all of a sudden I can only remember the acronym and then not the name, American Society on Aging, in partnership developed a certification course in gerontology. So there's not a focus necessarily on low vision, but for professionals looking, OTs looking for information on gerontology, the well done certification course.
Be interesting to see if there is anything in there about vision.
Yeah, I took the course, this is a few years ago when it launched, and I remember it being very cursory, but again, just thinking about people who may not have any kind of background in gerontology that come at it with low vision, with low vision.
Okay, awesome. And Cindy Kaufman, would you like to share a little bit?
Hello, there I am. I'm Cindy Kaufman, and I don't have the ability for some reason to turn my camera on. I don't know why I don't see that button, but I'm here. I just kind of wanted to share that I'm with the State Services for the Blind in Minnesota. And as far as one of your priorities, seeking opportunities to connect with quality healthcare providers, we are kind of doing that right now with my position. I'm the Aging Eyes Initiative Coordinator, and I go through and look for individuals and organizations who work with seniors, and we train them how to do some low vision assessment and provide them with tools and equipment to help them remain living independent. So sounds like we're on the same page there.
Terrific. Awesome. Fred, would you like to ask your question about fitness and exercise? Need to unmute.
Hi there. Can you hear me?
Yes. We can hear you.
Excellent. So many platforms, digital platforms.
Yeah.
Looking around for these buttons. I work for Children's Hospital Cincinnati. I specialize in low vision, and it's a partnership with the Kovernick Center for the Visually Impaired, for the Blind and Visually Impaired in Cincinnati, Ohio. I admit to working mostly with kids, although I cut my teeth at AFB a lifetime ago, and in New York. And I'm wondering about fitness and seniors and where that might intersect with blind and visually impaired folks. As president of past president of my local community council, we had AARP pick our neighborhood park for an outdoor fitness center. So, and I work a little bit in adaptive sports. Some of the stuff I'm too scared to do, like rock climbing and snow skiing and stuff like that with the kids. But there are things like hiking and other activities. And I'm wondering if anything is going on for older folks as well in that realm.
Well, it's interesting that you ask. Lauren Lieberman and I have worked on an aging and balance exercise research at the Center on Vision Loss here in Dallas with AFB. But I think in our purview, the connection to quality rehab service providers will open up the doors to fitness and exercise in as much as some of the NCOA, a matter of balance has been adapted, and several of the programs, evidence-based programs through NCOA have been adapted, and it's a matter of getting them implemented in the rehab services providers for people who are older and losing vision. Is it out there a lot? No, it's not. But it's a good point, and I think something that we could, we could keep in mind as what does quality services look like?
Yeah. One of the things I will say too is we have a doctor on our board who's actually developing an adaptive sports protocol for, so people can take their kids in and sort of just get a checkup and sort of a dispensation to go ahead and participate in adaptive sports. And so there might be an opportunity on the clinical side too.
Mm-hmm. Mm-hmm. Well, and so many medical professionals, if you're visually impaired, especially severely visually impaired, you go in and say, "Can I exercise?" They're gonna be, "Heck no, not a blind person. Are you kidding?"
Yeah.
You'll kill yourself. Well,
yeah.
We have to change that because that's
a competition of ideas for older folks than it is for kids, I guess.
Yeah, we definitely need to add that to the list. I want to keep us moving because we've got a few other great things to share here. Deborah Chaikin, would you please unmute yourself and share what you're doing?
Hi, I'm Deborah Chaikin from Aurora, Central New York, located in Syracuse. Nice to meet you, Lee, and see a face.
That's right.
I had shared with Lee before joining this committee about a new initiative that actually Lavelle Fund for the Blind helped fund, and we also had started funding from our district partner here in Syracuse, where we have developed a new eye center that is co-located with an affiliate partner of ours called Liberty Resources, where they have an integrated health model with primary care, behavioral health services, and now the new eye center. So it's very similar. They're very similar to a setup like a federally qualified health center, but they're actually an Article 28 clinic. Mm-hmm. And we have, we're excited. The eye center is about to start, open up on March 1st. But it is a new model for us. And it's expanding on our community rehab model by incorporating a medical model, because what we plan on doing is we have already recruited an OT who has job shadowed my staff and has actually had worked in an optometry office doing vision therapy. So she's extremely well trained already. And she's going to be actually, and you can bill for assistive device training using OTs. Mm-hmm. And there's other codes that you can bill for follow-up for low vision services. But in addition, we're going to expand by having her partner with our existing team of RTs and O&Ms by doing in-home vision rehabilitation, and we can bill insurances for that. So I just wanted to share with you a new model that we're testing out that we would love to do some research on. If you're ever interested in utilizing Aurora in this model to base any kind of evidence-based research upon, put that out there to you. And I would love to be engaged with this committee, because everything that you're saying is something that I have envisioned, and actually the model that we developed is really, it's so rewarding to hear your thoughts and your vision, because it is exactly where we are going with our services.
Awesome. Well, welcome to the party, Deborah.
Thank you.
We look forward to working arm in arm with you.
Excellent.
So we have 10 minutes left before we're jumping back to the full group. I want to acknowledge that many of you applauded Fred's point about the need for adaptive recreation for seniors and want to participate in that. There's also a fairly hearty discussion on how we break into or just make a dent with the medical profession. How do we get healthcare and medical doctors to appreciate what we're doing and partner with them? These are all huge themes for us and work that we'll be involved with. So there's just not enough time for us to discuss every one of those in depth. I think I would like to turn it back over to you, Ellie and Neva, to see where you'd like to go with the last 10 minutes of our breakout session.
One thing we definitely hope is implicit in your being with us on this call is that we can continue to communicate with you through email, and you can always tell us after the first email that you don't want to hear from us anymore. But I hope that isn't what happens, because as you can see, we need a lot of contributions from you, both intellectually as well as just in terms of getting some of the work done.
There is one more question that I think would be beneficial to open up here. Kendra's asking if you could give a broad view of year 2 and 3 for this committee. It's in the document, but you know, just a broad sense of what happens after the first year.
Oh, years 2 and 3, not priorities 2 and 3.
No, years 2 and 3. Sorry.
Yeah, well, I think we've been doing so much thinking about the first year that we've kind of relied on the theory of change document that expands into what happens years 2 and 3. I know we're going to be relying a lot on the work of the other 3 committees, because in order to get that kind of broad support, you're talking about the medical profession. We're also talking about funding sources. You know, we're going to need that data. We're going to need those outcomes that start showing that our impact, that our interventions have true impact and meaning in people's lives. We do have some research in that regard, but we certainly need a lot more outcome reporting in that regard. So correct me if I'm wrong, Neva, but I've been pretty much focused on this year, and by having our process focusing on 3-month chunks of the year, that kind of helps me, because I can say to myself, okay, as opposed to dealing with this incredible glacier, which is moving at glacial speed, but it's melting at the same time, I can just deal with these few little ice cubes here.
Exactly. I agree. I think Lee touched on it, Kendra, in the opening remarks, that, you know, we want 95% of people who are not getting any kind of rehab services, but are having trouble with their vision, to get services. And to establish that, we're going to have more people. We're going to have a framework of what do quality services for older people look like, and that kind of comes off of the best practices that OIB TAC has. We'll be working with that and helping people to you know, implement and evaluate those. And then also just, you know, getting more people to know that it's out there and access the services, the medical professionals, the allied health folks, the aging network folks. You can't imagine what's possible if you don't know that some of these supports are available. And too many of those medical professionals, allied health and aging network people can't imagine that somebody who has severe vision loss can do anything, let alone the scope of what they can do.
Yeah, and I'll chime in here too. So the process that we're using, Kendra, is as a group, we developed our 3-year plan. And of course, 3 years is not long enough, but the world changes so quickly anymore that going out much further than that tends to be an exercise in futility. So we have 3-year goals for the overall movement. We have a 2-year picture. So if you look in our 3-year plan, you can see the goals for the second year for the whole group. By the end of this year, we will look back and see what each committee was able to accomplish, and then develop the next annual plan by committee. But as Ellie said, it's sort of overwhelming if you try to take it on too far out with more detail. So I hope that helps, but you can take a look at the 3-year plan to know what we want to, at least in a big way, focus on in that second year.
And as you can imagine, we couldn't touch on everything even in that 3-year plan.
No. Well, we tried though, let me tell you. Working with a group of visionaries, our first plan was about 25 pages long. And I kept saying, less is more, let's get focused. We have to start somewhere, and we're learning as a group. I'm incredibly proud of the work we've done so far. So, any other last comments or questions? Do you have proposals for what we will focus on, your rocks in this committee, Ellie and Neva, for the first 90 days?
So our first rock is connecting with these personnel prep programs, and given the involvement of more people, we could expand that from blindness and low vision to allied health or gerontology, or just OT and then gerontology, or whatever. But I think our first step is to email everybody that signed up for this breakout, and then for you to respond and say how you think you'd like to help in the first 90 days of 2021 on our priority. And then that doesn't mean that the other ideas couldn't be done, but we would have to form subcommittees and have, a leader that's passionate about, for example, the fitness portion of this. Fred, you might want to lead a group that would come up with, some steps to take and move toward adding that to, what we accomplish.
Yeah, I think so.
Data and Research Committee, led by Jackie Borchardt, Vision Forward, and John Cruz, retired CDC.
I'm John Cruz, and I'm probably the idea person in this, and Jackie is really the responsible adult. And so she's very organized and a great co-chair for this group. But just real quick, I was at I worked for the Michigan Commission for the Blind for 15 years, and I've been and I ran a program for the blind people. For the last 3 years, I've been in Atlanta and spent the last 20 years working for CDC, and retired 3 years ago.
Great. Thanks, John. So my name is Jackie Borchardt. I am the Director of Operations at Vision Forward Association, which is a private nonprofit organization located in Milwaukee, Wisconsin. Very excited to have all of you here today with us, and excited to talk more about this really, really important topic that I think ultimately is going to drive much of what this coalition is looking to do. All right, we'll kind of just move down the line. If you want to, one at a time, go ahead and just give us a very brief introduction of yourself. That way we kind of know who's here with us and know some of what you have to bring to the table in terms of your experience as well.
So I'm Steve Tepper. I'm the Executive Director for the Arizona Center for the Blind and Visually Impaired, and I also serve on our Governor's Commission for Blind and Visual Impairment.
Great, thank you, welcome.
Good afternoon. My name is Lorene Sudan. I'm the Chief Operating Officer at Leader Dogs for the Blind, and we're not just about dogs. We have a wonderful team of comms who do orientation mobility services as well. And prior to my 8.5 years with Leader Dog, I spent a decade in serving older adults, both residentially and off residence. So I'm very interested in this topic and happy to be here. Thank you.
Great, thank you, welcome.
Hi, I'm Judy Matthews, and I work for the Department of Voc Rehab as an assistive technology specialist here in Colorado Springs. Before that, I worked at Lighthouse Central Florida in Orlando for about 17 years. and worked with many older adults. So I'm super passionate about this, and I'm happy to be part of this committee today.
Excellent. So glad to have you.
Thanks.
Hi, I'm James Michaels. I'm with Bosma Enterprises for the Blind and Visually Impaired in Indianapolis, Indiana. And we have a center-based program, a community-based and employment services-based program. And we serve roughly around 850 Hoosiers coping with vision loss every year. And I also serve as the chair of the Indiana School for the Blind and Visually Impaired here in Indiana.
Wonderful. Thanks so much, James.
Thank you.
My name is Chris Butler. I'm with Insight in Rhode Island. I've been the executive director here for 15 years. We're a vision rehabilitation agency and also have a radio reading service.
Great. Welcome.
Hi, my name is Amy Kale, and I work for Lighthouse for the Blind in our Seattle location. We recently opened up a low vision clinic during COVID time, so that's been very interesting. And we're embarking on a program review. So this this committee is really going to be helpful for me, I think. So thank you for doing this.
Thank you.
All right. Well, thank you for joining us.
Hi, I'm Bob Sonnenberg with the Earl Baum Center. And next time I promise to have the camera working, but today, no, not so much. So I'm thrilled to be part of this. The Earl Baum Center is a vision rehab organization in Santa Rosa, California. We've been around for about 21 years, 16 or 18 staff members, and serve 4 counties. And I had the pleasure the end of last year to meet John Cruz, and thrilled to get to reconnect with them. And data is always king. It's almost as important as cash is for a nonprofit organization. So thrilled to be a part of this group. So
all right. Very true, Bob. Thanks so much. Glad to have you.
Real quickly, I'm Ron Shukard. I'm the executive director of the Envision Research Institute, which is part of the Envision programs out of Wichita. I'm very excited. We've been doing research in outcome measures and things like that.
Wonderful. So glad to have you as a part. There'll be lots of things you can help us with in this committee.
Hi, my name is Melanie. Oh, go ahead.
Renu, I think you are muted right now, it looks like.
Oh, I thought I was waiting for, I'm Renu Minhas. I am the coordinator of client services and research at Deafblind Ontario here in Canada. And we provide residential services, residential and community services to individuals with deaf blindness. And we have recently seen a large number of people that are having age-related sensory loss. So we want to really learn from our big brothers and big sisters here. and I would like to contribute as much as I can from Canada.
Wonderful. It's exciting to have some international representation. Welcome.
Okay. Thank you.
And I'm Melanie Pesco from Louisville, Kentucky. Excuse me. I currently work with the APH Connect Center as our content lead for Vision Aware, which primarily serves older people experiencing vision loss. My background is in public health and program evaluation.
Great. Excellent.
Good morning. This is Mary Lee Turner. Am I off mute?
Yes.
Great. From Portland, Oregon, congenitally blind, good old ROP. And I've been a rehabilitation teacher, primarily working with blind adults in both Florida and Oregon for many years. I now work for a nonprofit organization, the Oral Health Foundation for the Blind. I lead seminars and workshops for folks new to sight loss. and I am aging. Yahoo! Very, very involved with pedestrian safety education for folks who are blind, and Oregon, so we can stop getting hit by cars.
Absolutely. Absolutely. Well, thank you for joining us.
You're welcome.
Hi, oh, go ahead. I'm the executive director of Valley Center for the Blind. We serve Central California, a couple different counties here. I was able to serve on a subcommittee of AVLNC for a little while and work with Jackie, which was wonderful, and was very excited that coincidentally I signed up for this group. We talked about research best practices and how there's only so much of that in the field and only so much that we have to rely on for data for advocacy. So very excited to be a part of this and to be here with all of you.
Great. Great to see you again, Shalina.
Hi, my name is Elise Connors, and I'm an associate professor at Western Michigan University, and I coordinate the Vision Rehabilitation Therapy program, and I'm excited to be here.
Great. Excellent. I heard your name earlier today when John and I were talking. We were hoping that you would be here today.
Yep.
Good afternoon. I'm Ian Shadrick. I'm a blind rehabilitation specialist with the Vision Center of Excellence at Walter Reed National Military Medical Center, and I'm also an adjunct assistant professor for the VRT program at Hunter.
Wonderful. Great. Thanks for joining us, Ian. Is there anyone that we've missed?
Yes. Can you hear me?
Yes.
I think I'm off mute. Hi, I'm Denny Moyer, and I am the founder and CEO of the Insight Skill Center in Colorado. We are low vision rehabilitation. We have a fully comprehensive program. We serve the entire state, and I am very fortunate to be working with Ron on outcomes measures. So I'm excited about that.
Great. Yes, outcomes is a huge part of what we want to address. So glad to have you here, Denny.
Hello, can you hear me?
Yes.
Hi, I'm Yusuf Diaz. I'm the Associate Director for Program Compliance at Miami Lighthouse, and I also oversee all our data for all our programs. And so it's very exciting to be on this meeting.
Wonderful. Thank you. Anyone else? I apologize. I should have been counting to know if we're through everyone. All right. Well, this sounds like a fantastic group. I am super excited about just the diverse knowledge and skills that all of you have. And what we wanted to do now is John and I wanted to just take a few moments and review the objectives that the two of us have come up with for this committee, and so that we have kind of a shared starting point. But certainly after John shares that information, then we'd like to open it up for discussion and an opportunity for all of you to share additional ideas of items that might extend beyond what we've initially identified. So John, I'm going to turn the floor over to you now.
Thank you very much. I apologize in advance. I have two dogs that are really interested in anything that's going on outdoors, and I can't shut them down during this presentation. Well, there are 18 of us on this committee. I kept count, and a lot of muscle. I am really excited about this. I think if we can bring together this much talent, we can get a lot of things done. So what I want to share with you is the initial list that Jackie and I came up with. But what I want to suggest is that this is a malleable list. And so I want to be able to, don't feel that we have to work with this, that we can in fact influence it. But if you're like me, I tend to review things at the last minute, and I thought it might be a good idea to kind of go through the things that we have identified, and then we can add some things to this list, and then I think we can go into maybe a little bit more detail for each of the objectives that we have, and have a bit of a conversation about that, and then do the other things that we're charged to do. So we identified 5 objectives for this work group, and we wanted these to be doable. with an be aspirational but doable. So the first is in this first year to conduct 3 seminars on data-driven science regarding vision and vision surveillance programs and estimates of vision problems. Just quickly, one of the stories I tell is at CDC, I would get a call weekly. People would be asking me, how many visually impaired people are there in the United States? And my set response was, you tell me how many people you want, and I'll show you the study that shows that number. And so the reality is that that there's a lot of variance in that because we're asking different questions. So, my feeling is that if we begin to address some of those issues and have a kind of a common knowledge that we can share, that it can be useful. So, so we identified 2 potential topics. One is to look at vision surveillance systems and state level population estimates that we can glean from a variety of sources. So that's one. The person who would be doing that would be Dean Van Nasdale at Ohio State, and I would be helping him with that. And the second, which we haven't prepared and done the research, but is to look at race ethnicity by county in the U.S. And so we can gather those data now, but I think it helps to identify some of the disparity issues. So that's, and then the others are up for grabs. We can identify additional topics and we can do that as a group. The second is to assemble just the literature. So if you're an academic, Elise can go to the library and load down all the PDFs. But if you're a civilian, you got to pay for that, maybe $40. And so if you're trying to do a literature search, you may pay $40 for it and not get your $40 worth. So we want to be able to assemble a bibliography and then print off the PDFs and make those available to the broader community. And so we can talk about that. So that's kind of a low-hanging fruit in this. The third, which we've already talked about multiple times, is this incredibly thorny issue of measuring outcomes. And there's lots of work, a lot of fragmented work that's been done around that. And so I think we have to address that if we're going to make progress. And I think there's some initiatives that are underway that I'm really eager to find out about. The first big research project I had was with the VA 30 years ago, and we were measuring outcomes. So probably some things have evolved since then. And so then we have some steps within that goal to wade into this topic. My fear, frankly, is that this really requires a lot of intellectual muscle and capital. You can't just do this, to bootleg this work. It's really serious work and needs appropriate support. Then the fourth is that when I was at CDC, the last thing I did there was that I was the lead for a Institute of Medicine, now the National, what's it called? I don't remember the name of it. But anyway, it's the Institute of Medicine did a major report on vision and public health. And one chapter in that has to do with vision rehabilitation. I insisted that chapter be in there. And so we think that that's kind of a consensus document that our group can use to advance the work that we want to do without having to do more work. And then the fifth came out of a conversation I had just a couple of weeks ago, and that is an effort to try to identify and suggest, not to require, some standard vision questions, associated questions that could be used in community surveys, so that we're collecting data in a fairly standard way and using questions that have gone through cognitive testing and validity and reliability. So those are the 5 objectives that we have. And just to remind you of those, and then our objective then is to look at additional topics that we might add to this list given the talent, I think we can be more ambitious than we have been in this. And then we need to set some timelines to some of these objectives. So I'll turn it back over to Jackie.
All right, great. Thank you, John. So as John mentioned, what we'd like to do now is to open the floor a little bit to all of you and hear some of your reaction around what we've identified and provide you with the opportunity to share additional thoughts that you may have about other items that you think may be important to incorporate into our work. Just as a reminder, these were set out as part of the 1 year of what's ultimately a 3-year plan. So please know that we know that this is certainly not all encompassing, but initially this is what we thought was achievable within the first year of this coalition. But would love to hear your thoughts and ideas about other things that should be included or incorporated.
This is Mary Lee. Can you hear me? Okay.
Yes,
I just
absolutely.
want to say that it was difficult to hear John. His audio, he broke up a lot. So just for the I don't know if that was true for other people, but just want to put that out there.
I'm going to shift to another computer.
Yeah, it sounds like the connection might be spotty or something because it kind of, yeah, it would just like stutter sometimes.
Jackie, by any chance, do you have those primary objectives that John was just talking about kind of typed out to go maybe in the chat? That might be a good reference
I
point
do.
for everybody.
Yeah, I can do that. Let me copy and paste those over.
It is
just give me a moment.
in the plan document that that Ben emailed to all of us at the beginning of the meeting.
Yes. Oh, looks like it cut off.
Thank you.
Number 5. Okay, you've got 1 through 4. And for some reason, number 5, maybe it was too long to all fit in the chat. So let me add number 5 as well. All right, so now you should have all 5 in the chat. So any initial thoughts or reactions? I know some of you might be reading right now.
So this is Lorene. Personally, I love the idea of assembling a bit of a library of documents. I think that will be really helpful for all of us in the work that we do. So thank you for thinking of that. I appreciate it.
I will give John credit for that one, but I agree. I have struggled myself, and I know some of the work that Shalina and I did as part of a task force that preceded this, in which we were providing a response to the Administration on Community Living on their plan. We wanted to ensure that we were citing incredible research in our response, and it was a little bit of a struggle. And I think if we had a really nice bibliography, that task, and I'm sure many other tasks for individuals in our field, would be much easier.
Hi, this is Melanie Pesco. I'm wondering if anyone has given thought to doing sort of a meta study of the various programs that are happening in the field, and then analyzing some of the data from those programs, doing some evaluation around programs that are currently in place.
Yes, and that would be a good thing to see how that fits in with the work of some of the other committees as well. Because one of the committees that's focusing kind of on quality services, I believe some of their work that they're doing is around kind of collecting some data around best practices. So, honestly, I think kind of the best practice piece kind of fits in between both that quality service committee and our data and research committee. And maybe that's some additional discussion we have to have with their committee is around where is the overlap and who's doing what, because I think that absolutely is an important piece of this, and one where we should be making sure that we're collaborating with that committee and doing it in the most efficient and effective way possible.
And I think it kind of goes hand in hand in having sort of baseline data that we're all using consistent numbers. And so if we look at some of the other programs that are currently underway or recently underway, then that sort of, that could just inform that body of knowledge. And with your, I think someone had mentioned about the PDFs, the scholarly literature that's out there. This also could be sort of part of that, and including just some evidence-based anecdotal information even from the programs that are happening.
Yes, absolutely. I've got notes of that, and that's a good point for some discussion with some of our other co-chairs to figure out how we can bring those together, because absolutely, I think as we look at, again, this push in order to get additional recognition, additional funding, additional access for our services, we really have to have the ability to back that up with data around the effectiveness of the services that are provided. And I think that does link into our point about the outcomes tracking as well, because I think that's another piece of the puzzle in terms of showing the efficacy of the vision rehabilitation services that are provided. Just a little background, I actually come from a different field. I'm a speech language pathologist by background, and you know, in the therapy, the physical, occupational, and speech therapy world, there's a huge emphasis placed upon evidence-based practice and around that really solid research behind the interventions that are utilized. And I think that's tied directly into some of the success that those disciplines have had in terms of third-party payer reimbursement. So I think this, again, is another linkage of the work of this group into that policy and funding committee as well, in that they're relying on us to be able to have some good data to back up their efforts to try to get some additional funding for our services.
Awesome.
This is James. I use a screen reader, and on objective number 4, was that, did I hear John correctly in saying that it's going to be we'll be compiling a 1-page document that'll just be consistent, that we can all use when we're out there talking about this concern, this problem?
So that one doesn't specifically state that. The number 4 is around reviewing that NASEM report and pulling some of the pieces. So from that section that speaks directly to the vision rehabilitation services, pulling from that, you know, research that has already been done around a vision rehabilitation and linking that to our work. I do think there absolutely is going to be a need for some common language, and John has actually done some work already in that regards, and so maybe I can have John answer this, but he's pulled together a white paper around some of the current data and research for vision rehabilitation services for older adults. It's much longer than 1 page, but that is a part of this, and maybe John, you can talk a little bit more about some of that work that has already been done, and maybe a way we can simplify that, or ways that others can utilize it.
Jackie, that may be a point of collaboration as well for the Public Policy Committee. I mean, if we're doing all of this research, knowing what initiatives the public policy has to take on could help us focus some of our research.
Yeah, absolutely. That's a great point. I wonder if John is maybe not connected back with us. I know he was. There you are. I see you.
Yeah, I apologize. I'm working with my other. I have the computer I'm working on is old, and so am I. So there's some failures in this. Just to answer Bob's question real quick, I just respond to that. I had a question recently about the opportunity to for an aging agency to collect data about vision as part of a community-based survey. And so some folks ginned up some pretty good questions, and it occurred to me that we have standard questions that have been used in population-based surveys that have gone through cognitive testing and have validity and reliability, and we have national data. And so what I put together was just a list of those questions and then tried to suggest the utility and perhaps a skip pattern. So, so I've put that together. It's a little rough. And what I would suggest is we have a nice starting point. If somebody's interested in this, I would appreciate your holding up your hand and helping me finish it up, and just so we can have something that we can share. I don't think it's necessarily a requirement that that we mandate anything. It's just that each question has different utility, and I think it's important for people to understand it. So, so that's kind of where we are with that already. I hope I'm not breaking it too much.
You just started. Your audio sounded good at the beginning, and just at the very end, it started to break up for me, at least. Yeah. So, just in interest of time, we certainly have the opportunity for ongoing discussion around these objectives, and I think what's been contributed so far is great. I just want to move on to kind of the next step of what we need to do during our time right now. Just, but again, no, we can certainly continue this conversation going forward. So what we wanted to do next is we've been charged with Lee to be able to come back to the larger group with some of those action items, or rocks as she's calling them, that can be completed by the end of March of this year. So John and I had a couple ideas that we thought we could start with. And again, these are open for discussion and input, but we thought this could at least be a place to start on each of these objectives. And we decided we had kind of at least one rock for each of the 5 objectives, those overarching objectives that we identified. So John, do you want to try your audio and see? Because I think you were going to do number 1.
Okay, is this better?
So far, so good.
All right, well, I'm on a different computer, so we'll see if this works. Yeah, so the first one that we wanted to talk about, that I mentioned, is conducting 3 seminars. And so we've identified one topic, and that is to have a kind of an overview. We're thinking, again, just to talk about the kind of the mechanics of this, we're thinking about doing a series of seminars, 3 or 4 years, something like that, and then archiving those so that when people either have an interest or they want to yeah, here I am. Or want to get some background information, they can do so. So we want to have those archived. So the first topic that we've identified is having a presentation on surveillance systems and state level data, because I think that's kind of what people are really interested in, is the more granular data that are available. And so I've talked to a colleague at Ohio State, a guy named Dean Van Nasdale, is a wonderful colleague, and he's willing to do that presentation, and we might end up doing it together. So that's one, and then I would like to, as part of this discussion today, if you're in agreement, we would like to do this first seminar in this first quarter, or at least plan it, so that we could maybe do it in March or April, so that we're doing something And then the thing that's open for discussion now is is to identify other topics that might be of interest to you. And we don't have a whole lot of time, do we? But let's maybe I could just get a little bit of feedback from topics that you might want to have.
I don't know if this is, if it's quite what you're thinking or not, but I'll just throw it out there and you can let me know. What about a topic, excuse me, informing program leads about effective data collection methods?
Sure.
I think that's a great suggestion. I think that's something that as a program lead myself, have struggled with a little bit, and it'd be great to hear directly from the researchers around the way to do that.
This is Mary Lee Turner. Can you hear me?
Yes.
Yep.
Okay. A question that concern, well, not a question that concerns me, but an area is that it blindness with low vision is so it's underreported and it's under collected. So you know, people they're asking questions from about other aging services or disabilities, but aging blind does not. It's hard for me. It's hard to find research that documents what's actually true, because blind folks don't report themselves often. They don't want anyone to know, you know, unless they're legally blind and it goes through some state agency. There's a lot of people out there that don't know that they don't have to be in this alone. So
yeah,
there.
I think that's I think you're getting at just a real problematic issue. I'll give an example. When I was in Michigan, I was trying to get the area agencies on aging to conduct to add a vision question to their needs assessment. And I talked to this guy from Detroit, and he said, well, we have a vision question. We ask, are you blind? And and they said, you know, and nobody responds to that. And I said, well, yeah, they're probably saying, you know, I'm not blind, but I just can't see anything.
Right.
So a big issue in this is what kinds of questions do you ask? And so and how is that portrayed? So I think
John, does that tie into number 5 then on our objectives around that idea?
That's probably a good
could
point.
Suggest.
We could do 2 things with that. I love this discussion, by the way. One would be we could address that as part of a presentation on surveillance methods, and then you use that insight to inform the questions that we provide that you could suggest. And so I think there is a tendency in let me back up. In the Obama years with the healthcare reform, the HHS mandated that in federal surveys that ACS, American Community Survey, disability questions be asked. It's a series of 6 or 7 questions. And the vision question is, are you blind or do you have serious difficulty seeing? Which is really useful for us, but not a very good question more broadly for vision and eye health, interestingly. But we can make a case for aging and others to be asking questions about vision because we have this national mandate. So knowing that, I think gives you a little armament to go in and make the case to do that. So that could be part of both of those presentations. I think that's an excellent question. Thank you.
Great. I think, John, maybe we should move on. Just again, this doesn't mean the discussion is done, but just so that we can get through as much as possible with this initial meeting. So the next one under objective 2, what we thought we could accomplish in the rest of this quarter through the end of March would be to establish a subcommittee that could start to assemble some research articles that they think would be helpful in terms of this bibliography. So the individuals who would work on this kind of subcommittee or task force wouldn't necessarily be people who would have to have access to the full text articles, but who could spend some time and at least pull some abstracts and citations of research articles that they think would be helpful for us to look to compile. So at least to kind of get this established and get it off the ground, identify some people, a handful of people who would be willing to work on this, and maybe someone who would be willing to take the lead in terms of kind of being the front person on a task force to address this.
And now back to the main room for questions and wrap up.
Okay, welcome back, everyone. I hope you enjoyed your breakout session. I was privileged to be a part of the Access to Quality Services group. Great discussion. And as we noted in that one, it's the beginning, not the end of discussion, but it is time for us now to go through each committee and learn what they will be focused on at least till March 31st. So I am going to call on one committee at a time. And I will encourage you, if you have any comments or questions as you hear those, to put them in chat. And we'll see if we can address any of them during this session, but please know that we are saving this, and that following this meeting, our steering committee will be regrouping early next week to debrief and make sure that all of these thoughts are captured and appropriately incorporated in our work. And you can also feel free to contact any of us outside of this meeting. Okay, so let's start with public awareness. Sylvia?
We had a fantastic group of people, and we might have made an error because I asked people to introduce themselves, which might have taken half of our time because there were so many people. But we had just such an interesting and diverse group of people, and I think that's one of the things that I think was important for people to realize is that we are representing services from across a wide sector.
Yeah.
So we talked about the public service ad campaign, and one of the things we were talking about towards the end was the flyer, and someone made a really really good point about that we're going to need to work on within the context of our committee, and that's making sure that we're using the right phrasing. They love the if you can't see something, say something, but there's some other parts of that might not feel as warm and fuzzy as we thought they did. And then in regards to the campaign, we also talked about the need for a place, a landing page, a website where people can find services, because it's extremely difficult to actually find services. If you don't know that services exist and you try to go look for them, it could be any, within the state agency, it could be among a number of state agencies, within the private sector, it's all over the place too. There's no one simple way to find services. And so having a place where when we have that national TV, radio, internet-based campaign where we can say, visit whatever site that is to find out more, something really catchy that draws people's attention that they don't forget. And Steve Kelly was really generous in offering up a site that he has ownership of. So we'll be talking to him, I'm not sure, but that'll be one of the things we'll be working on in our committee. So great committee we had, love it. That's it.
Awesome, thank you. And thank you everybody who joined that committee. And those of you who are planning to continue to work with them, thank you very much. Okay, next on to data and research, Jackie and John.
John, would you like me to talk or would you prefer to talk?
No, go ahead.
Okay. All right. So same as Sylvia, we did take some time to do some introductions. which did take up some of our time, but also was incredibly beneficial, just so we could learn a little bit about who the attendees were in our session and get a great sense of the skill and diversity that our committee brings. So we did get an opportunity to talk a little bit about some of the additions to our already established objectives. And it was really clear to me in that discussion that there is so much linkage of the work that we're doing to the work of the other committees. So one of the things that jumped out was this desire to have some data that backs up kind of best practices. And, you know, the feeling was that this links in very much into the work of the Quality Service Committee. So I think that's something that we'll want to continue to explore in determining what role each of our committees play in terms of identifying quality data, but linking that then to the provision of quality services.
Yeah, there's a lot of overlap.
Yeah, absolutely. So, and I think our data and research overlaps in many ways, because we also talked a little bit about data and research and its link into the Funding and Public Policy Committee as well. So I think, you know, it just made it very clear, and especially to have the perspectives of the new members of our group, just how interlocking all of these pieces are. So it was great that our committee members seemed to pick up on that right away and recognize the importance of the fact of not doing our work in silos and really continuing to collaborate across the different committees. We did start to talk a little bit about some of the things that we think we can accomplish in this first quarter. And one of them relates to our objective 1. And our plan is to, at a minimum, get something scheduled, if not actually be able to hold our first seminar around data-driven science. And this is something that John Cruz, my co-chair, and a colleague of his from Ohio State are willing to present on, is to talk a little bit about the work that has been done around surveillance systems and the state level population data. And I think this is going to be really helpful. And this would, our goal would be to do this as a webinar that VisionServe and AER potentially could then make available to their members, so that our entire field can learn more about the use of science and data in order to be able to tell the story of the work that we do. So that would be the first of our 3 seminars that we'd like to do. And we solicited some great feedback from our committee members about some other possible topics as well. Then our next item is with our objective 2. In this first quarter, we would like to establish a subcommittee and identify a lead person on that subcommittee or task force who can start the process of doing some collection of research articles and some compilation of items that we would like to have as part of a bibliography where we can pull together lots of different research articles into some sort of cohesive collection, I guess is maybe the right word, of eventually what would be full text articles that could be housed somewhere, whether with VisionServe or AER or a combination of both, to make that available to the individuals in our field, again, to help with using evidence in order to be able to back up our work and to be able to tell the story to funders and others outside of our field. So that was another thing that we thought we could definitely accomplish. John and I came up with a couple additional things that we can accomplish, but we did not get an opportunity to discuss those fully with our committee members. But we've got a good starting point and a really great group of individuals who are part of our data and research committee.
Awesome. John, is there anything that you wanted to add to that?
Well, yeah. We have 18 people who've signed up for this, including Jackie and me, and it's a fabulous group. So I just want to thank them for joining our group, but I think it's really encouraging. I mean, I think we can do much more work than I anticipated, given the talent that have come to this committee. So I'm really, really pleased with that.
Awesome. And let me just mention as we go through this, that you will, you know, afterwards, let us know if you want to join more than one committee, or you want to switch committees. You may learn more as you hear these report outs that intrigues you. And do you have colleagues that might be interested? This is not the only opportunity to declare your intentions. So just wanted to mention that. Thank you very much. Data and research. Next, on to access to quality vision rehabilitation services, Ellie and Neva.
We had a great discussion. We did not do intros. We'd still be doing them if we had. We still had a great discussion. And our priority one, which is to connect with personnel prep programs, is seemingly going to expand, especially if we get, the help that was in the room, to basically see how, at first we were going to focus during this first quarter on blindness personnel prep programs, but we recognize the fact that there's a need to also expand that to allied health, OT, PT, et cetera, geriatric and aging and health programs. I would think we could even, go beyond that into the medical eye care professional prep programs. It's a powerful thing to connect with people when they're in their education, to make them aware of what's happening, and to make sure that the courses that they're offering cover vision loss and aging.
Yeah, I agree. And I just wanted to also respond to Jackie. I think we saw also the interconnectedness between the four groups and the need for each of the rocks that those groups bring to the pile to make the goals come through. We had a lot of people, and we need a lot of people for this entire project. So I'm really delighted to see so many people participating.
Yep, to help us move our rock pile. I've never thought about it that way before.
I want to build a wall, please. I don't want a pile.
Oh dear.
Oh, no.
Well, sorry, that's a bad reference.
Little too soon for jokes like that.
Sorry.
It's a bridge. It's not a wall. It's a bridge.
There you go. Good job.
Thank you very much. And last but not least, policy and funding. Mark.
Thanks. Yeah. So we took very seriously the charge that Lee gave to us, especially us co-chairs, to stay focused on, let's make sure you come up with those rocks for the first quarter, and try if you can to drill it down to one. It's okay if you have more than one, but see if you can't make a priority out of them. And I think we did that. We won't recite the entire set of the three objectives that we have agreed are appropriate for us moving forward. The short summary of them is, what the heck do we want? Who can help us get there? And what tools do we need to have on hand to make it all happen? And so that first goal about what do we want boils down to the development of, is the goal of ultimately developing a message bill, a comprehensive piece of legislation. And in this first quarter, by March 31st, to have not every jot and tittle of that thing put down on paper, but to have a good, solid, meaningful, substantive outline for sure of what that bill would look like if we had, to clothe it then in legislative language. And so between now and March 31st, we're going to have, I know, a series of meetings. We may indeed need to break up ourselves into smaller groups, but in any case, that is our principal objective. That is our rock for this first quarter. The only other thing I will say is my experience in doing these coalitions for a while is, a lot of people will say, well, gee, that policy, public policy stuff, that, we know what's going to happen there, and we're happy to work in these other areas. And then funny thing, once the curtain is lifted on what the proposal ought to be, inevitably people come out of the woodwork and say, holy mackerel, I didn't think that was on the table, or what in the heck were they thinking when they proposed that? I'm only saying this to say to you, I think, do not assume that everything will be motherhood and apple pie and be predictable about what we may want to do in a comprehensive message bill. I don't think anyone who has an appetite for doing the same old stuff and sticking with the same strategies we've always stuck with. There may very well be some points that will raise some eyebrows within our own committee, but then beyond, we're going to want to make sure that we're taking an inclusive approach. So for sure, think about joining the public policy and funding group if any of this stuff lights your fire, but also know that for sure, our whole strategy is all about building as many partners as possible. So whether you're a part of our group or not, be watching for what we're doing, and we want you to weigh in. Thanks. Chris, any other thoughts?
Well, we did come up with a couple more rocks that we can work on regarding those other objectives, but they're, basically outline types of base, so we can know where we're getting started. So
they're not for our first quarter. There are certainly other rocks, but not between now and March 31st.
Right. Yeah. And so we had 23 people. We didn't introduce each other because we got right to what we were doing, but people are supposed to be emailing me as to their interest. And we certainly had a lot of people in the group who've been involved in this effort before. And so it was exciting to see them and their interest in doing it again. So that's a good thing. Thank you, Lee.
That's awesome. Well, great. I will just add a few other things that we will be working on through Vision Serve Alliance staff, and Lauren and I, as the co-chairs of the steering committee, are responsible for making this happen. And our rocks for the first quarter is to develop a plan for each of these things. So one of those is please know that our steering committee members, and we'd love any of you who would like to participate in this to let us know, that we are developing an annual calendar of national conferences in the aging, allied health, and eye care professional networks, and vision rehabilitation too, that we can present on about our coalition and our theory of change, the things that we want to accomplish in aging and vision loss. So we expect that to figure prominently in our work. How do we build these relationships? How do we build awareness of who we are? We've already submitted a number of proposals for these. So I would ask any of you that either would like to be involved in a presentation or are aware of conferences, seminars that you think we should be presenting at, we should consider that, to please let me know. Secondly, we're a very small staff at Vision Serve Alliance. We're a membership association and we function primarily on membership dues. Many of you are CEOs or members of organizations that are our members, and God bless all of you for that. It's not quite enough to fund all of the efforts that we're talking about here. So we have received a grant from the Gibney Family Foundation. We're very pleased with that. And I am pursuing several others. And based on what we have available, we will be either contracting or hiring additional staff to help us with this. So that's exciting. We also are planning to, and this is one of the reasons I want to talk to you, Kathy Zeider, and others who are interested in this, planning to develop and coordinate a Leadership in Aging and Vision Loss Academy with an initial cohort of 10. We hope some of you might consider going through this, or someone in your organization, that we can sort of educate, mentor, nourish to become aging and vision loss specialists, the front line of our army, if you will. So that's a special project for us. And then, of course, we're responsible for coordinating all of this, the logistics of the meetings, the listserv, the documentation, and our coalition. And then we hope that many of the efforts you all will be involved in will result in more types of briefing papers like the first one that our funding committee authored, primarily John Cruz, but many of you worked with him. If you haven't read that, that was one of the documents we sent out. We'd like to publish more of those and disseminate those. And we did mention that we'll have a listserv. We already have an AVLNC website page at Vision Serve Alliance and a document portal, and we will continue to maintain that. Hope that you will dig into that and utilize some of those. So we have about 10 minutes on the agenda right now for us to be quiet and take other questions, comments, now that you've heard more from the full contingent of our steering committee and council. What else would you like to mention or ask about? And you can, right now, if the first person can raise their hand and I'll call on you, but you can also add things to chat.
And Anicio has had their,
Oh my
their hand up for a while.
I'm sorry, you must be on another page than I'm looking at. So Anicio, let's hear from you.
Hi, can you hear me?
We can.
So a great program, and I look forward to participating. I noticed that there was some information in the chat and some links. It's very hard to read, to monitor the chat while you're talking or listening to the, with the screen reader.
Mm-hmm.
So I wonder if there is information that is valuable, if Ben or someone could then send it to us.
Yeah, absolutely.
Thank you.
Yes, and we are saving all of this. We're recording it, so we'll have the chat, and we will be harvesting all the information out of that for our committees. But happy to share it with you as well as appropriate. Thanks for asking that, Anicio.
Thank you.
Other questions, comments, suggestions? We'd love to hear from you. I hope I'm not missing anybody. I realize there are 3 pages of you.
Lee, this is Alaya. I work with since Pris helps us with the Vision Aware site, I'll work with Pris on trying to move our part forward and try to coordinate that so that the next time we meet, we may have something more laid out to report back to you.
Great, thank you. Love your photo that you have.
Elf.
You can't see a picture of Elf.
From the movie Elf. I love that movie.
Yeah.
Oh my gosh.
That sounds like fun.
Yes.
We have
Larry
Larry
Johnson.
Johnson.
Yeah. Larry Johnson, would you like to unmute and tell us what's on your mind?
Okay, I think I'm unmuted. Am I?
You are.
Good. One of the suggestions that I made in the breakout committee of public awareness was that there's a real importance, I think, for us to involve non-blindness agencies and organizations. And I'm wondering if you, Lee, or any of your steering committee folks would have some significant contacts with organizations like AARP. They could be really critical if they were willing to cooperate and perhaps be even a clearinghouse for referrals of people experiencing trouble with their vision to their local chapters or to agencies and organizations that provide services to blind people. It seems to me that it's very, very important for us to expand our resources to involve those types of organizations that traditionally only serve seniors.
Yeah, absolutely. We agree with you, and that's a significant tactic, if you will, that is woven throughout all of the committees. So AARP is on our master list of wanting to talk to. They certainly could do the things that you've mentioned. They're a behemoth, and getting a contact is the trick. I do have from the chat that our good friend Richard Tapping from Vispero is offering a contact to start with. This will take some cultivation, but absolutely, we want to be dialoguing with AARP and others. You're absolutely right. I mean, building these bridges and really true working relationships with national organizations in the aging, allied health, and other networks that we talked about are critical to our success. If we don't do that, we in fact will not be successful.
Hi, my name is Bonnie Lucas, and I am in Anchorage, Alaska. We have one little center here. It is a member of Vision Serve Alliance, the Alaska Center for the Blind and Visually Impaired. And so I really appreciate this. Throughout our state, our grant is divided 4 ways. 3 of the other agencies are throughout the state, and they are ILCs. And so when they go to hire someone, they're generally people who know next to nothing about blindness. So one of the things that we've been doing, and I think getting more information from this whole group of people and ideas will be so helpful. But what I've been doing as a VRT is having people join our support group, even, and inviting these providers to join our support group so they see what we do and how we talk to, help people with, different challenges with their vision loss. And we've tried to have quite a variety. I'll just briefly toot my own horn and said I actually made brownies on Zoom with my daughter following me around with my iPhone and such.
Oh, wow.
And more than one, well, yeah, it was very cool. More than one client, and I gave great detail. Actually, I looked at it later and thought, I could have even done more. But the detail of exactly how you use your hands and what you do and gathering your stuff and blah, 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 measuring everything and putting it in the oven. All of that stuff was really helpful to one woman that I had talked to a number of times. And she said, you know what? I felt like I could cook again, even just that little bit. I felt like, okay, I can get back in the kitchen and at least start. And so that's the kind of thing that I've been trying to do is figure out ways to involve these people that are working with people in their own areas. And again, in Alaska, it's like sometimes like searching for needles in a haystack to find the people that we know they're out there. We know there are plenty of people with vision loss, and yet it is really a challenge to find them, even with these other ILCs. That only covers a portion of our state. I know there are others really out there. Anyway, so I think it's going to be exciting to see how a state like Alaska can put to use so much of what's been being discussed and what's being planned. So I thank you for this opportunity.
Thanks for participating, Bonnie. And I'm going to ask Ben to email you a link to the documents that we have on our website concerning provision of services remotely. We gathered quite a lot of resources last year, and also to those resources that Sylvia Perez has collected at OIB TAC. And
Yeah.
if you're not familiar with OIB TAC's resources,
I am.
please, okay, good. Everybody jump
Yeah,
on
and
the website.
and I, as a blind person, I'm out there a lot, seeing a lot of resources. And I guess I just want to say one final thing, and that is, the people that struggle the most are the people that, for example, a lady I have, she's actually still driving, but she is beginning to experience more vision loss, and I think that won't be going on. She's, pretty magnificent as an 85-year-old. She's amazing, actually, but she can't join our meetings because her little flip phone doesn't work inside her house, and she
Right.
doesn't have long distance on her other phone to join our Zoom. So I already have one person who comes regularly, bringing in a person on her phone, her iPhone, and I've already decided, I've figured out another person that could bring this lady in. And so I think it's, innovating things like that. Sometimes you have to pair people up, and then they really become a cohort that is interested in serving each other and helping each other in ways that maybe some of us as professionals, can't do even.
That's right. Great strategy. Thank you very much. Thank you for sharing.
Sure. You bet.
Okay, so we have come to the end of our time for discussion,
Yeah.
and we are moving into concluding. If you have anything else that you'd like to share, I promise we'll do it with you. Just please add it to the chat. And as we've all said, feel free to reach out to any one of us to further this conversation, learn more, and get involved. What I'd like to do right now is just talk a little bit more about the logistics of the structure of the coalition. So as I mentioned, we have a steering committee, and our steering committee meets frequently, probably more frequently than they ever imagined that they would be asked to do. But especially in the beginning, it's important, and I think our work is telling. And then we have the 4 committees. And so following this meeting, you'll be contacted, and please reach out to us and be persistent if you're not getting connected to the committee or committees that you want to serve on. We will make sure you get connected, and they will be organizing their meeting schedule. It is anticipated that every committee will meet at least monthly. There may be additional meetings. And last year, many of our committees ultimately broke out into task forces. So there may be that opportunity to focus even further through the committee. And then once a quarter, we're going to come back as a coalition, just like we did today, and we'll hear what was accomplished by each committee. And we will decide, okay, what are we going to do the next time? The next quarter will be ending June 30th, and so on. And then at the beginning, probably December is always tough. So probably in January, we'll conduct our annual session again for the next year. So we have exciting things on the horizons. Please spread the word. Please let us know how you'd like to participate, and keep those comments and suggestions coming. In the chat, if you're able to access it, we've already posted a lot of information, but if you're not, please don't worry. We will get this back out to you as we conclude. I don't think we have any, none of the committees have established their first meeting date, correct? Co-chairs?
We haven't. This is Chris.
Okay, yeah, I don't think so. Okay, so then we actually have a few more minutes before we break up, if we'd like to share anything else. Any other comments, suggestions, questions? Go ahead, Mary. Mary Lee Turner.
Yes. Can you hear me?
We can.
Okay, sorry about that. I, as a blind participant, it's really difficult. I'm really eager to get the chats that were online, but I mean, sent in.
Yep.
But when they are spoken, it covers up the dialogue of who's actually speaking.
Yeah.
So I bet that you get that. I would love to have the resource that was referred to about services to, how was it said? Anyway, folks.
Remote services?
In outlining, remote, yes,
Yeah.
remote services.
Okay, we'll make sure you get that, Mary Lee. We have, there's been quite a bit gathered through OIB TAC, through Vision Serve Alliance, and I'll mention one other, although it's not specific to aging, but there could be transfer. And WinTAC also has collected an amazing amount of materials for the delivery of services remotely to teenagers and working age adults. So check them out too. They have curricula.
APH also has a lot.
Oh, and APH. Oh my goodness. Thank you, Sylvia. How
Yeah,
good.
I think Hadley, Hadley is just a good resource for remote training too.
Right.
Leah, I would just like to mention, this is Ellie, that Neva and I are meeting on a weekly basis on Mondays with each other. And so when we get emails from people who are interested, we'll be able to work through that to find a meeting time that's good for everybody.
Okay, great. I want to call out Judy Matthews. Yay, Judy's on the call. And Judy and I used to work together at Lighthouse Central Florida, and some of you worked with her in Miami. And she has now, if you didn't know, she's moved to Colorado, but she's made a really good point. Judy, would you mind unmuting yourself and just sharing this directly? Where is Judy? Wonder if we lost her.
Oops. Can you hear me?
There she is.
Can you guys hear me now?
We can.
Awesome. Sorry, I was muted on my headset as well. Nice to see you, Lee, and nice to be here. Thanks, Patty, for sending me the information. I was just mentioning how it's such a huge need to have some good sensitivity training in healthcare, because there's so much just lack of information, education, and heard so many comments from people that have been in rehab and hospitals and nursing homes where they don't feel like they're treated with dignity and respect. They're not, their needs aren't being met because people don't understand the needs of individuals who are blind or visually impaired. And so I think that it would be, it would just go a long way if we could develop some sort of standard sensitivity training that could be shared in
Amen.
healthcare. Mhm.
Amen. It's so important. And John Cruz just recently published an article that he co-authored about the prevalence, incidence of vision loss in nursing homes. It was astounding. I did not realize. John, you care to comment on that?
There we go. Yeah, I worked with a colleague who's an optometrist in Delaware, and he had a practice where he was doing comprehensive eye exams among people with vision impairment in nursing homes, and he collected just a ton of data, which we then analyzed just a portion of it. But what we found was that 65% of the residents of nursing homes reported either blindness or vision impairment.
Did
So
everybody hear
about
that?
Wow.
65%. So about 15% had a visual acuity of 2200 or worse, and 50% had a visual acuity between 40 and 2040 to 2200. We, in that paper, which I can share, I mean, we can put it on make it publicly available to everybody. But there was just tons of eye pathology that was identified. And, if you were to ask the directors of nursing homes how many people had vision problems in a nursing home, I bet you would get 10% or something. So it is certainly underappreciated and under-addressed.
This is Sylvia, and having used to have gone and do outreach to nursing homes and independent center, what do you call them? Independent living centers, or long-term, you know what I mean?
Long-term, yeah.
You'd say, hey, we can provide services to your residents. I don't think we have any. Maybe we have one. And you just knew that wasn't accurate.
That's right. Right. Let's see. Do I have any other comments in the chat or hands raised?
I'm raising my hand, Lee, although I can't find the button.
Okay, go for it, Mark.
Just on that point, and perhaps this is discussed today in other committees. We did not talk about what I'm about to say in the public policy space, but it is so critical. I think one of the things that contributes to that dynamic you were just talking about is the fact that so many of us, I have been guilty of this, are wedded to the word, the capital B, blind. I'm never been ashamed of being blind or visually impaired, but I think in this effort, we have got to find ways in which we, don't hide that under a bushel, but find ways to talk about all of our activities such that we eventually get to a point where we have divorced the notion of sort of aging and vision loss from the sort of capital D disability space. I think we often get written off based on that. We get shoved in other piles based on that. And when you try to reach out to exactly the people you're talking about, they're thinking you mean people who look like Jeff Tom or even Mark Reichert for their sins, as opposed to grandma who just can't see too well, who is part of our community, but we haven't done our job to make sure that that profile is as included in our folk as we could. And I think as a result, others have followed that inappropriate example.
Awesome. Yeah, and Carla McCaney brings up a good point that the Joint Commission that accredits Medicare and healthcare requires competencies for cultural, age, language to treat patients as individuals. Is this an opportunity for us to insert sensitivity training and understanding at that level?
Yes, yes, and yes, and yes.
Yep, all good stuff. Several of you have asked how to get added to the listserv. And so I think what we're going to attempt to do is assume all of you want to be added to the listserv and give you the option to opt out. Is that all right? You'll get an email about this once it's up. And then if you don't want to be on it, which is perfectly fine, yeah, you can just opt out, but we'll assume everybody wants to and go the other direction. All right, good. Any other comments or questions before we, I mean, it's always fine to finish early, right? We can always enjoy getting a few minutes back of our time, but this is an interesting group. So if you'd like to share anything else, you have the floor.
Yeah, I would. It's Janet from Lighthouse Bill, Janet Weinstein. I'm thinking that's an interesting statistic about nursing homes. And I'm thinking what that really does is it underscores the need for increased public awareness. And even further, that probably if I would guess, and this is a little controversial, that if people were reached and given appropriate vision rehabilitation services, there'd probably be fewer of them in a nursing home.
Amen, sister.
Yeah.
And fewer diagnosed with dementia, we suspect.
Well, exactly. Dementia, which is often misunderstood. I mean, I do a lot of talks, say, older adults with macular degeneration. There are plenty of them. And when you look at them, they don't look like they're visually impaired. They don't meet. So, and they won't identify. I say that, your cousin can look at you and not recognize you. And you think that's dementia when it could be and I know a lot of people, when there's central vision loss involved, a lot of people don't get how they may not be able to recognize you, but they can find something on the floor. So yeah. It's a misunderstanding about vision loss and what the resources are. And, to say even further, for some of these senior living places who are in trouble now financially because of COVID, but some of these places where people are paying to go. I know there was one chain in particular that was trying to do a special wing for people with vision impairment, comparable to what they were doing for people with cognitive impairment. And we tried to tell them that what's beneficial in terms of environment for people with vision impairment benefits everybody. And it's not the same as dementia, clearly. So there's a real public awareness gap. So I'm so glad that you're addressing that.
Great, thank you. Thanks for that input.
Thank you.
I think the sensitivity training needs to be twofold, because it needs to be, of course, sensitivity training about how to best meet the needs of people with visual impairments, but also creating awareness about vision rehabilitation and how to refer and those things.
Judy, you need to, both of you and the previous person need to come to the awareness committee. Just saying.
Yeah, absolutely.
Yep.
And I'd like to make this point on behalf of Melanie Bush, who suggested it, because no, I don't believe it was mentioned, Melanie. Let us not forget the Native American populations, often served by Indian Health Service. They're unreached and underserved, and we need to make sure that they are included in our outreach plans. Thank you very much.
Are Indian Health Services federally qualified?
They actually have there's actually a technical assistance center for them, but it's
great.
around VR, but I'm trying to make that connection.
Oh, fantastic.
And when I was at the National Council on Aging conference a couple years ago, was it a couple years ago, Pris? I actually made some connections with them, but they really, it's, everything takes a lot of work and follow up and follow up and follow up. But I've made some connections over there, but we really need to do a lot more with that.
So this is Lauren, just to, we're in the heart of a lot of Native American, You know, so we've been working with them. I mean, we've been working with them. And so whatever, I mean, we've got some of the largest tribes, I mean, here in Oklahoma. And so, you know, it is a difficult system to manage. It's a pretty closed system, but we are working with Indian Health Services here and the various tribes. So whatever inroads we're able to make, we certainly will pass those on.
Terrific. Thank you, Lauren. Okay, last chance to dance. It's so much fun when you have this many people on, and every time someone makes a comment, a lot of you don't have your cameras on, but we still have a lot who do, to see all the heads shaking together, nodding. It's so reaffirming.
That's a fun little piece of audio description there. Thank you.
Yeah.
Look like a bunch of bobbleheads.
A lot.
Yeah, bobblehead.
Mark, no one was shaking their head during your talking points, though.
Isn't that nice?
Oh, boy. Okay, well, on that happy note, I think we will call this closed. Again, thank you all for your participation. Help us continue to get that word out. Go back and review the documents, read the, watch the video, and respond to the email when we set up the next meetings. Thank you very much. Have a great weekend, everyone.
Thank you, everyone.
You too.
Yes, thank you. Everybody stay safe.